Okay, could I just check that somebody sent a link to Graham Howe? Is he with us?
I think I shall be.
He is with us.
I'm here, Alison.
Excellent.
Warwick, we can see you.
Right. Well,
I hope that's a benefit.
Okay. It is. Good evening and welcome, everybody, to the November meeting of the Children's Services Overview and Scrutiny meeting. I'm Councillor Alison Swaddle and I'm chairing the meeting this evening. If I can just introduce for residents who may be watching us tonight on YouTube, we have councillors Malcolm Richards with us this evening, Jim Fruin, Pauline Hellier-Simons, Andrew Mickelberg, Abdul Lloyd, Andy Croy, and David Hare. I hope I haven't missed anybody else. Oh, and Ken Mile and Guy Granderson. Just quickly looking through the participants. And we're welcoming officers. Let's have a look. Adam Davis, David Clifton, Gillian Cole, Kim, are you an officer?
Evening, Councillor Swaddle. Yes, I am. I'm an officer that works in the strategy and commissioning team. I'm here for the CAMS review item.
Excellent. Nick Hammond, Piers Brunning, South Thurlway, and we are welcoming Catherine Turton Rice, who is the Deputy Schools Commissioner for the South East. Right. This is being broadcast live, so can I remind everybody to speak respectfully, using appropriate language for meetings. Please keep your microphone off unless you're speaking, because background noise is very distracting. And if you could also remember to switch off any devices such as mobile phones or Alexa, and only put your camera on when you're speaking. Luciana, is there anything else important I need to mention?
No, I think you covered everything.
Okay, so do we have any apologies for tonight's meeting?
Yes, we received apologies from Prue Bray, and she's being substituted by David Hare, and we had apologies from Jenny Chang, and she's being substituted by Abdul Lois. Ah,
yes. So we've got some guest councillors on the call this evening. Then, when I saw Councillor Patman and Councillor Granderson. Joining. That's excellent.
Yes, Alison.
Is Daryl with us this evening?
Sorry, Alison, I was just saying I want to do it.
Darryl Ward, our parent governor representative. That's all right. That's you're always very, very welcome. So we've got two apologies, and if we could then move to looking at the minutes of the previous meeting. Members, does anybody have anything they'd like to raise about that? Sorry, not about the meeting, about the records, whether they are an accurate record of what was so that I can sign the minutes off as a true record. Andrew, did you have your hand up? Andrew? I can see Andrew Mickelberg has his hand up.
Yeah, sorry, yeah. I believe they are a true and accurate record, but I did have some questions about the minutes.
So they're not going to be, they're not an issue that might be raised in one of the items later?
I don't think so.
Okay, go ahead, Andrew.
Okay, so under the performance indicators, last time we looked at dashboard 1, EHCPS. Is there any progress on including numbers of EHCPS applied for but not issued? It doesn't appear in the latest report. And then I'm also wondering, under dashboard 6, the care leavers, whether in the next meeting we might be able to receive details of the Wokingham care leavers' participation in the government's apprenticeship scheme that's specific for care leavers, and whether there are any opportunities for increasing this participation. But a report for the next meeting. Thank you.
Right. Can I ask Sal if you could address the first point, and perhaps we could look at the care leavers and apprenticeships when we're discussing the forward programme?
If
Chair. Sal feels that the data will be available. Thank you, Sal.
I can, Chair. My apologies that it's not included in the report for this meeting. You're absolutely right, Councillor Mickleborough, to raise it. It's an oversight on our part, I'm afraid. I'm more than happy to provide the data as it would have been presented this meeting to you outside of the meeting, if that's helpful. And we will ensure that it's in the data pack going forward. I do apologise for that oversight.
No problem.
Right. Any other members would like to ask about the minutes? In that case, Luciane, we will accept those as an accurate record, and I presume at some point in time I'll need to come to shoot and to sign these.
Yes, they will be signed when we can.
Thank you very much for all that you do with the minutes, Luciane. Okay. As members know, I'm doing my best to be paperless, which is slightly delayed. Okay. Do we have any declarations of personal interest regarding items on the agenda this evening? I can see no hands going up, so we will presume there are not. Now, we're now moving on to the public questions, and we have two questions. First of all, from Beth Rowland. Beth, would you like to ask your question? Is Beth here?
She was having problems getting on, I know. Getting onto Teams.
Well, in that case, let's move to Morag's question, and if Beth is able to join us, we can then take her question. So, Morag, are you ready to ask a question?
I am, thank you, Chair. Nationally, 60% of schools have failed to sign up to the government scheme to claim free sanitary products. Period poverty is a source of inequality in our society, and it is being made worse by the financial instability in the COVID crisis. Without access to free sanitary products, girls are resorting to using toilet roll, newspapers or socks to cope with their periods, or worse, missing school. What is the Council doing to alert primary and secondary schools to the free scheme and to monitor take-up of the scheme by schools? Thank you.
Thank you for asking that question, Morag. And thank you for bringing the government scheme to the attention of the committee. I am aware that all schools have recently been advised of this scheme, but I shall ask that colleagues reiterate the availability of free sanitary products.
Is now exiting.
And I will request that we review the take-up of scheme by Woking schools so that this can be fed back to a future Children's Services Overview and Scrutiny Committee meeting. Do you have a supplementary question, Morag?
I do, please. I was just wondering, will the Borough Council be able to develop this into an ongoing relationship, or is it more transactional?
Well, as you'll be aware, most of the secondary schools in our borough are academy schools, which we offer strong support, and we do have a good relationship with those. But also, I think we're all aware that girls from the age of 9 or 10 these days can have the need of sanitary wear offered in schools. I think I'll ask Sal if he'd be able to add some more to the answer I gave.
Absolutely, Chair, and thank you, Mr. Melvin, for bringing the question and the supplementary. As Councillor Swallow said, we have recently contacted all schools within the borough, maintained academy and free schools, to advise them and signpost them to the government scheme and encourage them to participate. We do have an ongoing relationship with all schools, and as such, we are able, over a course of time, be able to go back to those schools and ask about the take-up of the scheme and understand how schools have made benefit of it. We're absolutely aware of both the physical health implications for young women in relation to period, as well as the emotional impact and well-being of young women at that time, if clearly sanitary products are not available to them. So we are encouraging schools. We will continue to work with schools, and we will be following this up and hopefully report back to committee on the nature of that engagement and take up at some future point. I hope that responds to your supplementary, in as much as our relationship is ongoing, and it's not just a simple we'll inform you once and then it's job done. It's absolutely much more than that.
Well, that's very helpful. Thank you.
Thank you, Sal, and thank you again for joining the meeting to ask your question. You're very welcome to stay for the remainder of the meeting, Morag.
Oh, thank you.
Lucianne, has Beth managed to join us? I couldn't see that she was online.
I can't see her name on the list of attendees.
Okay, so in that case, we'll send her a written answer.
Okay.
I'm conscious that we do have a very large agenda this evening.
And also the answer will be published with the minutes, so it will be visible on the website in time.
That's right. Now, do we have any member questions this evening?
No, we don't.
Okay, moving to item 30, which is the Regional Schools Commission update. We're going to receive a verbal update on the work of the RSC within our borough's academy schools. So, as I mentioned earlier, very warm to Catherine. I heard an alert that she'd left, but I hope she's back again.
I'm here. Sorry, I had problems with the Teams. Good evening, everyone.
Good evening, Catherine. So we're delighted you're able to join us tonight. And I know members have lots of questions. So I'm going to call on members to speak and go around in alphabetical order. So Andrew Mickleborough, would you like to begin?
Yes, thank you very much, Chair, and thank you very much, Catherine, for joining us this evening. I do, in fact, have 4 questions, if that's okay, and if possible, I'd like to divide them into two groups. So the first question is, do you, or does the RSC have any concerns that some academies may not be responding as well as some others to the multiple challenges resulting from the pandemic? Is there any additional specific monitoring in place to detect if and when this might be the case? Are there additional and new supports in place for any academies that might be experiencing pandemic-related problems? So that's the first question. And then the second question is, what do you believe are the most common problems, non-pandemic related, facing academies in our borough, and what additional actions are being taken to help tackle these problems?
Okay, thank you. Thank you very much. So in answer to your first question, we don't have any particular concerns about schools in Wokingham Borough in any particular sense, but what we do is we monitor schools' attendance very closely following their input into our data portal, which is done on a daily basis. We also received soft intelligence from the education team in Wokingham. So if there are any concerns there, we follow up with them and have a conversation about how they're supporting those particular schools and how we can support them. We also, following that, if there are sort of significant concerns, we would offer what we have at the moment is called a COVID recovery school-to-school support package, and that is where we match up a school leader in the sector with a school, and they have a dedicated amount of time which is tailored to that particular school's individual needs, where they can focus on things such as remote learning, how to put that across, how to use catch-up funding, and how to sort of remedy lost leadership capacity. So I've answered one question, I believe. So the other question was about the common problems facing schools and academies. So it's responding to outbreaks, most definitely, an issue that we're seeing not only in Wokingham but across many schools across the country, reduced leadership and staff capacity as well as finances. That is a big hit for many schools, the fact that they can't let out their schools in the way that they used to, which is leading to a loss of earnings. And in some cases, we've got some schools, not in Wokingham, but where there is a significant loss in terms of school business management capacity.
Thank you very much. That's really helpful. My final two questions are, particularly in view of the current rising levels of financial hardship in many families, does the RSC monitor at all the costs that academies impose on parents, particularly very expensive, often school branded uniforms and sports clothing? And is this an area in which the RSC possesses any levers to try to limit the impact of this on families? And finally, and I hope it's not inappropriate to ask this question, but please everybody take it in the spirit in which it's offered. Yes. How would you characterise the working relationship between the RSC and our borough? And in the spirit of continuous improvement, do you have specific areas and ways in which this working relationship can be strengthened further?
Okay, thanks again, Andrew. In terms of the uniform question, unfortunately, we don't have particular levers to ensure schools are sort of asking parents to buy good value for money uniforms, or not charging excessive amounts of money for expensive branded sports clothes. It's up to a trust board or a governing board to decide how the uniform is sourced and therefore the costs of those uniforms. We do publish best practice guidance on school uniforms, which I can share with you, and it's clear in that guidance that schools need to give high priority to the costs considerations. The government at the moment is supporting a private members bill, the education bill, to make guidance on school uniform costs and the considerations of those costs on families statutory. We are aware of the financial pressures at the moment that many families are going through because of the pandemic, and we are urging schools to consider how they are going to manage pupil non-compliance, which might come as a result of the pandemic and children not being able to wear the proper uniform. And then in terms of the relationship between the RSC and Wokingham Borough Council, I would say, and we would say, it was a very, very good relationship, which has really enhanced during the pandemic. One of the silver linings of all of this, we've got regular communication, whether that's email or phone conversations, and sharing of soft intelligence has been really helpful from Wokingham for us to feed back concerns that lots of schools have and feed that back up the necessary channels. And we will continue this relationship beyond the pandemic. And also what we've been doing more of is also bringing in other parts of the department, like our SEND colleagues and also our children's social care.
Thank you, Catherine.
Thank you.
Andy Croy, would you like to ask a question to Catherine?
I don't have any questions, thank you. I don't think I put any in, did I?
Well, I know not everybody had the opportunity to be able to put them in. Okay, well, members, do you want to raise your hand if you're waiting to ask a question rather than go round? Malcolm, I can see your hands up. Please go.
Thank you, Alison. Yes, I can speak. I thought actually Catherine was going to give a verbal update first, and then we would probably ask questions based on that presentation. However, I do have a question I can ask anyway. Schools obviously are going through a difficult time at the moment with COVID. Some schools are open, some are not. Some are open and then they're closed, and not all the students go. And even if it's open and they go, they might have to close because of people falling ill. We also don't know whether the secondary school exams will take place next year, and all of that is outside your control. So my question was, what thoughts have you got on how you can, I don't know, standardise or equalise any statistics that come out, because they're going to be all over the place based on partial participation, no participation, and uncertainty. Do you have any thoughts on how the statistics will be meaningful to anybody based on that mixed bag of events?
So, to clarify, Malcolm, do you mean statistics in terms of exam performance next year?
Yes, that is one part of it, and the other part is just progress generally throughout the year. How are you going to get any meaningful information on progress and whether they're improving or getting worse, or just staying still, and the exams? It basically looks like it's a very difficult job to do with so many variables.
Yes. I'm afraid in terms of that, your questions, Mark, and those sit out of the RSC's remit. But what I do know is that our policy colleagues within the department are working hard to make sure that exam results, once exams happen next year, which will be, I believe, delayed by a short period in May and June, to June and July, that those will reflect what a mixed bag of attendance many children would have experienced this year.
Okay, thank you. Obviously, in any one region, then, all the schools are clearly being compared. There's a comparison and a competitive aspect to it, and some schools may suffer outside of their own control. Yeah. That was all. And I wondered how you could get some fairness into it. Do you have any thoughts on it? That was all.
Well, this year we haven't released any performance tables, and of course when we do get the results next year, I'm sure we will again take into consideration the fact that there are some schools who would have suffered more in terms of responding to the pandemic and pupils' attendance than others. And I would hope that those schools would not be penalised in any way, given, yes, the very difficult 2 academic years it would have been there for many schools.
Okay, thank you for that.
Thank you.
Sal, do you want to add to that?
If I may, colleagues, I just wanted to, might be helpful for members to be aware that in Wokingham, thankfully thus far we've had no school closures, and that our attendance across all schools, and including attendance of those children from vulnerable groups, i.e. those with education, health and care plans, or those open to children's social care, have been high. In terms of Wokingham attendance. Our school improvement service is working incredibly hard with schools around making sure that we can maintain that as the Wokingham picture as we go through. So we've got really, really robust coronavirus risk assessments and response plans enabled to make sure that we can reduce the level of risk. Unfortunately, we can't completely eradicate it, but reduce the level of risk of school closures. We've also been working with schools to make sure that there are really high quality home-based learning opportunities and provision put in place. So should children have to isolate, that the schools are very quickly be able to switch to a home learning model so that we can again minimise the impact on children's learning, both at primary and secondary phase. I just think it would be helpful just for colleagues to be aware of that local context, in the context of the broader issues that there are nationally.
Okay, thank you, Sal.
Okay.
End of my question.
I noticed David Hare had his hand up earlier, but it's gone down now. David, do you want to ask a question?
I was going to ask a question, but Malcolm beat me to it. So, and so did Andrew.
Okay.
So my questions have been answered. Thank you.
Okay. Well, if anything else arises, stick your hand up again. Abdul. Councillor Lloyd, do you have a question?
Yes, thank you, Chair. Hi, Catherine. My question is regarding PME school children, about their achievement. I know there has been, I think one of my colleagues mentioned about closing schools and, problem with COVID-19. Not every school every class is they're attending. Do you have any concern over those children in end of year when they're going to attend their exam? Because if you could elaborate a little bit for us.
So in terms of if we're taking it as a local context, not in particular in terms of Wokingham, nationally, we are looking at that very, very closely and ensuring that we get the sufficient data from all of our local authorities about the attendance of BME students, and will, in the round, look at how we can support families and schools to ensure that as many children return or have some form of education this academic year, so they do not fall behind. And if they are in the exam years, whether that is year 6, year 11 or year 13, that they are able to perform as well as they can next summer.
What sort of support are they getting at the moment?
In Wokingham or nationally?
In Wokingham, please, yeah.
I would have to defer that question to Sal. But I know that Sal and his team are working very closely with the representatives from the BAME community in Wokingham to make sure that those children are in school, or any concerns, as well as staff as well, because that's another thing we need to think about, BAME staff who might be concerned about the effect of the pandemic on them as well. But I know that he's been working closely with those particular groups.
Yes, it is the case that we're very, very mindful to BAME communities, but as Catherine says, both as students and pupils, but also as staff. We're working incredibly closely, not only with schools, but with our public health colleagues around both understanding the implications for BAME communities in relation to the coronavirus impact, but also doing lots and lots of work at the moment in terms of racial equity in schools to make sure that the impact is minimised as much as we possibly can. As I've said, in all of this, unfortunately, there's no way that we can eradicate risk, but we do need to make sure that we are attuned to where there is greater risk that we need to be mitigating as best as we possibly can.
Thank you, sir.
Do any other members have a question for Catherine? Okay, well, I will ask a question. Catherine, we've recently been very concerned about Northern House,
yes,
which is a children for children with a lot of quite specific needs. And I know you've chosen a new academy track. Could you give us some insight into how that process went and how you chose the provider?
Okay, so as you're probably aware, Alison, Northern House transferred to Chiltern Way Academy Trust on the 1st of November, so this weekend, which is really, really good news. After a year-long process of actual transfer, we're ecstatic that it's been transferred to what we believe and know is a strong trust in Chiltern Way Academy Trust, based in Buckinghamshire. In terms of the process of matching, the RSC considers a lot of factors. We look at a variety of trusts who we feel have got the expertise and the knowledge, but also the capacity to bring about rapid improvement. It's really, really important for us that we choose a trust that can improve the school and improve it very quickly. And that's what we felt with Chiltern Way Academy Trust.
So, do you have full confidence that we're going to see huge improvement at Northern? Is it being renamed?
It's been renamed to Chiltern Way Academy Wokenham, I believe. So,
that school does a long history of problems through different providers. So we really would like to see a big improvement there.
No, and totally, and we want to see a very good, a rapid improvement there for our most vulnerable children in society. And as we feel that Chiltern Way are the Academy Trust to do that, they run a very successful school in Buckinghamshire already, which and they commission quite a few places from other local school places from other local authorities. They're in conversations with Oxfordshire County Council and Hertfordshire County Council because of the great reviews that they've had in terms of the progress that they make with children there. And I know Sal has already had started very a good relationship with the trust, and that's the difference with a lot of SEND schools, that when you've got SEND academies, they are still relying on the local authority for places. So a good relationship with them is vital. So I know that is grown over the last year between the local authority and Chiltern Way, and will support the school improving as we go forward.
So until recently, Ofsted were visiting every month because of the level of concern. What will be happening with that going forward?
So Ofsted, I believe, were not visiting every month, but on a termly basis. That would what would happen in terms of on all inadequate schools. It might have been that an Ofsted visit happened maybe at the end of one term, and the middle, I believe, February of this year. Was the last inspection or monitoring inspection of Northern House or Chiltern Way Wokenham. In terms of what's happening now,
did that stop because of the pandemic?
Yes, that stopped with all schools, and Ofsted is an independent body from the Department for Education, but Ofsted would only go in between March and now and until the beginning of the spring term. Ofsted are only going in if they've got significant safeguarding concerns about a particular school. They are doing visits at the moment to all schools to see how schools are responding to the pandemic and ensuring that children are sort of catching up in the use of the catch-up funding grant that's gone to all schools, and also seeing how they are responding to sending children home if needs be because of an outbreak, and the remote learning and the quality of that provision. So I know that they were starting with inadequate schools and maybe some RI schools, but they're also visiting good and outstanding schools to see how that happens. But they would only most definitely do a visit and perhaps even give a judgment if a school had significant safeguarding concerns. So once those visits, those inspections start again, and again I say I believe that will be in the spring term, they would start their sort of normal routine of monitoring inadequate schools. But because Chiltern Way have got Woking have got a new URN, they probably won't be inspected for a sort of 2 or 3 years time. But what would we would do as the Regional Schools Commissioner, we would have regular conversations with the new Academy Trust, and we can do that still virtually. I'm speaking to the Trust tomorrow, and I will continue to have monthly or termly conversations about the progress being made.
I think, well, I'm speaking for myself, but I do think members may agree with me that that's very concerning, because this school was having, Ofsted, we could read the Ofsted reports, we could discuss them in this committee. We're charged in Wokingham of ensuring that every child is provided with a good education. Clearly, with Academy School, our office says we don't have the same relationship and the same data and evidence that a good education has been. So Ofsted's regular visits to Northern House to look at the improvement there was very useful for us. And now you're saying that as a committee and as borough councillors, we're corporate parents of every child in Wokingham. We're not going to be given any evidence-based report on the education provided at that school for 2 or 3 years.
And unfortunately, that is the case, and that's the case with all schools, regardless of whether they are a maintained school or an academy. Once a maintained school,
a maintained school. We
so what I was going to say,
we have regular information about.
No, so with a maintained school, if it was inadequate and it would have to convert by law to become an academy, they have a new URN, and therefore they are outside of the inspection window until 2 or 3 years later after they have converted. And that is the same for an academy that was inadequate and transfers over to a new Academy Trust. As I said, it's out of my remit. Ofsted are an independent body, and those are how they operate in terms of their framework.
Yeah, Sal, did you want to come in?
If it's helpful, colleagues. Catherine's absolutely right in terms of the formal Ofsted inspection regime, both in terms of the suspension due to COVID, but also in terms of what happens in terms of the change of provider in URN. However, as she also said, we have developed a really, really positive working relationship with Chiltern Way Academy Trust over the last year in terms of the improvement activity and our improvement expectations from a local authority perspective. We've been really, really strong in terms of our commissioning and contractual arrangements with Chiltern Way Trust for any students that are Wokingham learners that are placed at the school. And we will be continuing to have conversations with them around that improvement activity that they will be continuing to do. It's useful to note, actually, that Chiltern Way, commissioned by the RSC, came in and commenced that improvement work prior to them taking on the school formally as the incumbent trust. So they had already committed and started to deliver around that improvement agenda before the 1st of November, where they formally became responsible and became the provider of the school. I am confident. I have been out and I've seen their other school setups, had lots of conversations with them and their leadership team. I am at this point really, really confident that they will be able to deliver the improvements that are necessary. And of course, through that continued engagement, we will be watching for that. And if we feel that things aren't moving in terms of improvement, we'll clearly be challenging them directly. And we will be making sure that the RSC, so Catherine and colleagues, are also kept well informed in terms of that local intelligence, which is really, really important.
Good. Yeah.
But it's right that unfortunately we won't be able to report in terms of Ofsted reports to committee until those Ofsted inspections recommence.
Yes, most definitely. Thank you, Sal.
Well, I think from what Catherine said, we have to hope that Ofsted don't come sooner, because that would mean there were serious safeguarding concerns.
Yeah.
We don't want to be hearing this.
Absolutely.
Catherine, we've got another new special school opening here, Oak Tree. Could you tell us some more about the decision-making process on how you chose the Maiden Early Trust to run that school?
So that was I believe, sorry, I don't know the detail of that. I'm not as closely aligned to, but that was the decision was made around their capacity and their and the expertise that they were going to bring in, because as you are aware, Maiden Early are predominantly a mainstream trust. So it was about really analysing their plans to take on or to open a special needs school, and scrutinising those in terms of who they were going to bring in, who had the expertise to A, open up a free school, and B, open up a special free school as well. They also are working at a school in Reading, which is a special needs school, so they are, gaining their expertise there. But it is a rigorous.
Which school is that?
That is Phoenix College in Reading.
Oh yes, that's moving to Hamilton. Isn't it going to become the Hamilton College?
Yeah. Yes.
Okay. Is it possible for you to say, were they the only applicant to run Oak Tree, or did you have a wide group of trusts to choose from?
I believe we would have had a sort of, not a wide, but several other options. But again, as it's outside of my knowledge, I can't give you as much detail as possible. I'm afraid. Sorry, Alison. Sal, to you, because that was a school.
If it's helpful, there was a competitive process. We, as the local authority, are involved in that process. It's led by the DfE, but we're part of it in as much as we have the opportunity at local authority level to scrutinise the tender arrangements that were put forward to bids, and to meet with each of the trusts that had expressed an interest. From that exercise, we feed that in to the department to say, actually, this is what we found, and our assessment, which the Department for Education will then match that with their intelligence, their information, and that's the basis upon which the DfE will then finally make the decision. So it's a decision that we have also been party to, and subsequently we've met with Maiden Early Trust in terms of the initial development and thinking about how we make sure that we're moving things forward and smoothly.
Great, thank you for that, Sal. Very useful. I think some people feel Maiden Early's taking over in our area. We've got such a large number of schools now. I'm chairing. I can ask another question. Catherine, we often we found that the Keys Academy Trust are managing more and more of our primary schools that have chosen to become academies, and some of our residents can sometimes be concerned that it's a Church of England Academy Trust. Is that a fact? How does the Regional Schools Commissioner approach that of making a school, putting it under the management of a particular religious organisation?
So what the keys have are essentially something called mixed mat articles, which would ensure that they are ensuring that the provision that they provide for the children in a church school is the same as what they would provide in a community school, so to speak. So they have to sign up to that and ensure that they are not unduly imposing a particular religious ethos on a community school when it comes into their trust.
Okay, thank you for that. There's an awful lot of fireworks going off.
That's okay.
Members, does anybody else have a question? Right, in that case, I'd like to thank you very much for coming and answering our questions tonight, Catherine. Is there anything that you wanted to give us an update on that hasn't arisen during the questions?
No, it was just really, again, to reiterate the fact that the relationship between Woking and Borough Council and the Regional Schools Commission Office has, strengthened, especially during this period of the pandemic, and I hope that will continue. And that was all really, and I've covered the questions in terms of around our monitoring process for schools and academies who might be coming under undue pressure because of the pandemic. But yeah, thank you. That was all really.
Okay, so thank you very much, Catherine. I'll let you get back to enjoying your Thursday evening.
Thank you very much for having me. Thank you.
Okay.
Thank you, Catherine.
Bye-bye.
Thank you.
All right. Moving to the next item, item 31, which is mental health and emotional well-being. Who is joining us to present that report?
Good evening. My name's Andy Fitton. I work for Berkshire West CCG, and I'm one of the co-authors of the report. I don't know, it's my first time with you. Is there a particular way you'd like me to do it, or what would you like to? How would you like me to proceed, Councillor Swaddle?
Would you like to give us a brief overview, and then we'll take questions from the members for you?
Okay, so good evening, everybody. Just to confirm, Andy Fitton, one of the authors of the report. Also, I think there's a colleague, Kim Wilkins from Woking and Borough Council, also on the call this evening. Effectively, we were asked to present you with a report that covers a couple of different areas of offer for children's emotional well-being and mental health. So the first part of the report gives you an overview of a critical document called the Local Transformation Plan. Every year for the last 4 or 5 years, we've presented that through by request into the Health and Wellbeing Board. So we did that again recently, which I think has some similarities to this report. Effectively, the LTP, as we call it, is an opportunity to provide an overview of the achievements and the things that have been achieved within the system, as in terms of the partnership of providers and the CCG and the local authority over the last year, and to give a sense of what really still needs to be achieved going forward, so a sense of priorities. So today the report gives you a kind of an overview of what has happened and been achieved, and there is a lot of detail for you to maybe ask questions on, but I just wanted to pick out a few of the highlights. So The first one is the establishment of the first local mental health support team, and you'll see in your pack of papers at the end there is a briefing about that particular service, which is a nationally mandated new opportunity to provide an early intervention and support service that's co-located in our community around the schools. And so within Wokingham, it's about a third of the borough that's covered by that single team as its first pilot. And we're hoping in time, NHS England will fund further teams for Wokingham. Secondly, that we have seen an increase in access to services, both at a early intervention stage like youth counselling and support in schools, but also with our specialist CAMS service, where you've got higher levels of anxiety or depression or a particular diagnosable mental health condition. We recognise that demand continues to increase year on year, and we can see that in our referral rates into our specialist CAMS and other areas. And I think national prevalence surveys across the country is showing that mental health and emotional wellbeing issues amongst children and young people is increasing. So it's something of high priority and something that we continue to want to get right for children and young people. We've got an extensive and a very much improved training offer that is both targeted at schools in the area, but also at children's services staff or professionals that work with children and young people. The key aim there is to try and support professionals who are working day to day or week to week with children and young people to identify early mental health needs and to respond and get the help those children and young people need in as quickly as possible. And we continue to try and find ways to invest more money going forward, in particular high-end need services like the crisis response or our eating disorder service. You can see in the report we've identified 7 key priorities going forward that is currently being worked on across the partnership at the moment. Some really critical ones that I just wanted to highlight today was we really are working well with the Children's Services team on a service that we want to try and engineer for that's specific to children in care. And we know that that would be an enormous benefit, that we would try and carve out a particular resource that would just work solely with that particular important corporate parented group. We've been investing a lot of time, energy and more resource in our crisis response, as we do see things. You'll notice in the COVID update, one of the real significant factors was that although we saw referrals go down, partly because of lockdown, what we did see was a higher number of acuity of presentations of crisis. So we have continued to see crisis presentations at places like hospitals be a really important piece of work for us going forward. And I suppose the other thing that we're still working on is the trying to get a really good early intervention, a good response to eating disorder cases in Berkshire West. The governance of our local transformation plan, just for your reference, is that we have a partnership group that Wokingham, schools and children's services, the CCG, our CAMS service, all sit around the table regularly every month and work through the issues to try and improve our offer to children and young people. And that reports into a children's board that's now set up through something called the Integrated Care Partnership, which I'm sure many of you are aware of, is the new iteration of how we're working collegiately across Berkshire West footprint of Reading, Wokingham and West Berkshire, across local authority and the CCG and the health providers. And then finally, just to bring to you a highlight, we were asked to give a kind of an update of the impact of COVID, which we've done on page 19 of the report. So there's some key points there. I suppose I've already mentioned some of the highlights, which is we did see referral numbers go down, but we saw acuity of crisis go up. We were really impressed with our providers as they brought a digital offer very quickly to the table and accelerated, like many services, its ability to offer a distant but supportive service going forward. And although we saw acuity go up, we did see a huge amount of collaboration between providers, and that was incredibly supportive of each other through what was obviously proved to be a very difficult time for children, young people, families and staff going forward. So I'll pause there, Councillor Swallow, and obviously if there's questions.
Okay, what I failed to mention, and I do apologise, is that this item you're presenting, we invited all of the members of HOSC to attend as well. That's the Health and Overview Scrutiny, because some questions were raised from their committee, but particularly I highlighted in your report the concern about the growing number of self-harm in young. So, Luciane, it is perfectly acceptable for the HOSC members to ask questions at this meeting, isn't it?
Absolutely. Yes.
So, thank you, Lucian. Guy, you had your hand up.
Thank you, Alison. So my question, I've got two really, and thank you for the report. I think it's quite useful. The question I've got is specifically around on item 31. The on page 19, as you mentioned, was the table for the average waiting times. Why is it? This may be something I've missed or misread or something like that, but why is the anxiety and depression time seemingly so much out of kilt compared with everything else? Because depression, the black dog of depression, is perhaps one of the greatest risks to people's mental health. So why is that waiting time seeming to be high? Is that a comparison, or what's going on there?
Do you want to ask your other question at the same time?
Yeah, the other one is also in regards to the online youth counselling service, COUth. I just wanted to know if there's been any feedback from users as to how useful and how receptive it is to them and how useful it is, because the data itself seems good, that people are accessing it and the numbers seem acceptable. But I just want to know if there's been actually any feedback from users, because because when using some of the online stuff that I've used in lockdown, for example, there are some that are absolutely fantastic and very easy to use, and there are some that are like pulling teeth. So I just want to know if there's been any feedback from users on that front. Those are my two main questions.
Okay, so I'll start with the easy one first, which is the youth counselling one, probably. So, no, I don't have any direct feedback to give you today from that. We actually, Kim and I have got a meeting with the provider next week for the first time. So we've only been running the service for 3 months now. So I'm fully expecting to be able to get a sense of support from the provider coming back. And I've not heard or had any feedback given to me from schools or through sort of ways of doing things. So I don't have anything to offer today specifically to that. So I don't think I would pretend otherwise. Your other question, which is anxiety and depression, is yes, that is high. That will be probably because of the number of referrals coming in for that is outstripping the capacity of the team to meet that particular demand coming through. So that would probably be the main things. So would be probably the main reason why. But I don't have a direct correlation, but that would be my basic understanding of that.
Okay. So it's more that demand on the anxiety and depression team is significantly higher because of lockdown across the board, and it's not just an issue that we're seeing to the data presented here. It is a for lack of a better description, a national issue that has increased. So supply is outstripping demand at the moment.
Yeah, I mean, what I would suggest though is I can go away and get you some more data behind that, because without that kind of being really clear clear. I don't run the service. I have the data, but I don't necessarily your specific question. I don't have the actual kind of data that says it's outstripping. My best guess is that it will be because we do see high numbers of referrals for anxiety and depression, and that's particularly true of Wokingham. Actually, that has quite a high level of anxiety and depression referrals. But what I can do is go away and feed that back through to the committee, maybe a more comprehensive answer. But that would be my best guess.
That's fine for me at the moment. Yeah, I would like to know a bit more, significantly more about that, because the number is striking. I mean, the second contact, as it were, that's half a year, and that is shocking. And we need to do, and if that means that we need to lobby MPs for more money for mental health, for lack of a better description, mental health experts that deal with anxiety and depression, it is key, because especially as we enter the winter, I fear that the numbers will increase, because traditionally people feel more down when it's dark outside.
What we're planning on, within mental health on the whole, what we're expecting, and a lot of the conversation is about what we're calling a surge coming through later after lockdowns. So on the whole, referral numbers, as you can see, weren't that high through lockdown, particularly for children and young people, but we're expecting more now. It will be interesting now we're into a second type of lockdown, what will happen to referral numbers in November. But with schools still open, we would expect referrals to continue, because that's the biggest difference from a children and young people's perspective compared to the first lockdown. So, yes, I'm very happy to take that question away and have a conversation with the service and bring that back, if that's of help.
That would be very helpful. Thank you very much. And thank you, Andy. And that's me done for this one, Alison. Thank you.
Okay, thanks, Sky. The next person I saw to raise a hand was Andrew.
Yes, thank you, Andy. I have quite a number of questions, if it's okay, and I'd like to begin by just picking up on Guy's question about Couth, which does sound to be, a very, very interesting initiative. Would you be able to feed back to the committee our feeling, our view that we would very much like, there to be some formal monitoring and evaluation process around Couth, and for us, to be included, in sharing of the results, when that happens. So I have a number of other questions. On page 17, you referred to the new inpatient facility to replace Willow House, which I believe has a current capacity of 9. At any given point in time, are you able to tell us roughly how many young people have had to be placed outside of area? And will the new facility offer exactly the same services as Willow House, and or any additional services? And then a kind of joint question around data on self-harm rates and eating disorders, both of which you mentioned in your verbal report. Is there any evidence yet that the new initiatives are beginning to have an impact? And I believe really importantly, what disaggregated data is being collected and monitored on self-harm and eating disorders locally? For example, by ethnicity, by age, number of repeat incidents, and so on. I do have a couple of other questions later, if that's okay.
Yeah, I was going to suggest, in terms of Willow House, it's not my, so just to be really clear about Willow House is the CCG don't commission and pay for Willow House. That's run through an NHS England commissioning arm. So it may be better that my suggestion is you may want to write specifically to them to ask much more your clear questions as a committee going forward, in terms of what is the new arrangement that you would be expecting from Willow House going forward. The way now inpatient facilities are organised is they're organised on a regional footprint. So the way a young person would experience that is if they're in need of an inpatient facility, there's a crisis team that will probably do the initial mental health assessment and make the decision through a consultant that that's what's required. That then will go into a regional process to try and place that children and young person as close to home as possible. possible. So when you asked about out of area, it depends on whether you see Wokingham as the out of area, Berkshire out of the area, or regionally out of the area. What I do know is that we have across the country, we are struggling to find beds for children and young people at the moment. So it is again something that people are working incredibly hard to increase the capacity and availability of beds for children and young people. So again, you're right. So they can stay. I think for us locally in this situation would be sort of within the what we call the Oxford, the Buckinghamshire, the Berkshire footprint. So families could still visit within a reasonable sort of distance because these are very specialist hospitals. They're not something you have a lot of in every community. So when you say out of area, I think it's probably a little bit sort of how we would define what out of area means. So I'm saying it might be better that you ask NHS England that question directly, which I think is a very reasonable one. I agree. So I think your question about self-harm and ED in terms of impact is so the self-harm data comes through our public health colleagues, and that's on a yearly basis. And so my understanding is we're still waiting for the next iteration of that data to come through to show whether that has changed at all from the last time I looked at it. So I can't comment specifically about whether that has improved or not currently. I think we've always got the backdrop that we're putting in a huge amount of effort to try and support children and young people as early as possible, like the mental health support teams. And I think that will eventually have an ability to impact on it, but it is against a rising tide of numbers overall. So, you know, I would say we are working incredibly hard to do stuff around that. And in terms of eating disorder, the numbers have gone up year on year. And again, as you can see, one of our critical things is making sure that we respond very quickly to that when it comes through. So when you'll see that the waiting times, that they're particularly quick to respond to children and young people's eating disorders. One of the really critical things that we do well is to make sure that we have a good response time when a child is identified as having an eating disorder. We aren't seeing those numbers go down at the moment, but we are hoping that in time that will happen, as you suggest. So I can't report a change just yet. I would agree with you about the disaggregation of the data, and that's where you'll see in one of our priorities, we're doing a health needs assessment with our public health colleagues, and that's where I think we will unlock the potential of understanding the cohorts that sit beneath the headline figures. So that is a piece of work that's ongoing at the moment through our colleagues with public health.
Yeah, thanks for that, Andy. I have two other sets of questions, if it's okay. You mentioned the urgent care crisis support offer, and I see that in section 5.20, priority 3 is to continue to build a 24/7 urgent care crisis support offer. How would a child seek urgent help at the moment, particularly if they've not received this before? Are we confident that the kinds of help on offer are known to young people, and that they're currently presented in a manner that a young person facing a mental health need is likely to feel comfortable accessing? And then my second question focuses specifically on assessment and waiting times for assessments for children to access support for ADHD. Some of our counsellors have heard reports from residents of a 2-year wait for ADHD assessments. What are the current waiting times? What's been the recent trend? What's being done to reduce these waiting times? And then linked to this, one counsellor reported to me that they heard from someone yesterday who attended an ADHD training course with a local charity that they'd heard that CAMHS has now suspended ADHD assessments. Is this correct? And if so, could you please elaborate?
Shall I start with the ADHD one, because that's fresh in my mind where you just said it. So I'm not aware of suspension of any assessments at the moment, so I can't comment on that sort of hearsay effectively. That hasn't been communicated to the CCG. Wait times are going up for ADHD. Again, the numbers of referrals, I don't have them to hand, but we can, because it's a complicated one whether you see ADHD and ASD as a mental health condition. It's kind of one of those ones that kind of can be seen either way in that respect. We try not to report on them anymore as a CAMS thing. They've been separated out. But waiting times are going up. I think the last time I looked at waiting times, on average, it is unfortunately gone up over a year for a waiting time, but I can get that confirmed. Exactly how long it is in writing would be helpful. So let me just take a note of that. Trends are up. So we are seeing increasing numbers of referrals coming through from GPs and schools for ADHD assessments. Reducing waiting times is all about capacity. So we have looked to invest in digital solutions, not just face-to-face solutions, because finding the workforce to do these assessments is incredibly hard, and finding the resource to do that, to meet that demand, is incredibly difficult. So that what we actually have been focusing on as well is just the support while people are waiting, which is why some of the charitable work you described, the CCG funds, knowing that while people are waiting, they still need the support to actually help them manage the condition or the potential condition they're in. In terms of your urgent care offer, I think it's a really important thing to try and understand the different concepts of crisis here. So one young person's crisis may not be the same across the board. So people present a crisis at schools, at their GP surgery, at many different places all the time. And we are working very hard to help those people who they present their crisis to know what to do as best they possibly can. The majority of the time when we think about a crisis, they actually present in two classic places. First of all, they come to the hospital because they've hurt themselves or potentially going to hurt themselves. And when they present at the crisis, the hospitals know exactly what to do, and they are absolutely connected with the right services at that point. The other place often might be in an incident involving the police. Might be the other classic example. If a child goes missing or they're threatening to hurt themselves and the police get involved. And again, what the police often will do is then connect with the right parts of the health system to do that. So I'm quite confident we have services like street triage that's available to the police. So in the most crucial kind of high level crisis positions, I'm confident that those services, and we're working very hard to make sure they're, for example, we've recently set up a professionals line so people can call in as professionals to see what support they need as police, as ambulance, who actually might see an absolute high level crisis. But we're working very hard with people like teachers and GPs to give them the confidence when a child presents and it seems like a crisis, they know what to do at the same time. And just to say, also just to be really clear, the introduction of 111 and its profile is increasing all the time, as I'm sure we're all aware through COVID and now. And we now have a mental health crisis line that sits alongside. So if you ring 111 and you have a mental health issue, often you're feeling like anxious and things are getting out of control, you will get eventually through to a mental health professional who can help you talk through what is the option that you need to do. So that is a big strategy for us to get that open access so that people can ring 111 themselves, which obviously a young person can do if they need to at that point.
Thanks, Andy.
Look, David, could I just ask why the chat function's been muted for this meeting? I think it's David rather than Callum tonight. Is it, Lucian?
So, no, we can use the chat function if you like, but that will not be visible on YouTube.
Okay. No, that's fine. I know. I know earlier Rachel asked a question. No. There's a chat function, a meeting chat on here, and it seems to be working again now. It was showing us muted when Right, I'm sorry. That's good because sorry I didn't mention earlier that we're also welcoming Councillor Rachel Burgess joining us here. Now the next person on my list, because I'm noting these in order, is David Hare. Would you like to ask your question to Andy?
Thank you, Alison. Really, my question's been answered because Andrew Mickelberg covered it, but I'm like him. I'm worried about it. Again, yes. I'm worried about ADHD. I have a relative who was waiting for a good 2 years from initial referral until he got a diagnosis of ADHD. And is there anything that we as a local authority can do to help that or to work with that? Because, yes, it is concerning.
Are you asking me, sorry, or colleagues from the local authority? Sorry, David, I wasn't sure. Councillor Hare.
I'm asking, yes, if you think there's anything that the local authority can do, because it just seems such a long time and there's such a gap between referral and diagnosis so often, and a lot can go wrong in that time.
Yeah, I mean, one of the big things that we're trying to work with local authorities, and I don't know if Sal will comment, is we're trying to move away from the need to having referrals to meet their needs. So, sorry, let me say that again. We're trying to help people move away from the fact that you don't need an assessment and a diagnosis to still identify and work with the need of the child or young person in front of you. And that's particularly true of schools. That we want to suggest to schools is don't have to wait for a diagnosis to actually work and identify what their needs educationally and socially are to then work with them going forward. The neurodisability or neurodevelopmental area, you don't have to have a diagnosis to access support. You don't now need a diagnosis to get the right bits of work done within your school. So that's the bit we need support from both the local authorities and schools, is otherwise parents feel like it's a barrier to getting help, and we would argue it doesn't have to be that way. There is help available and whilst you're waiting for your assessment. So that's the help that we would need.
Thank you.
Anything further, David?
No, that's great. Thank you, Alison.
Okay, thanks. Jim, would you like to ask your questions?
Thank you, Chair. Andy, I just want to build on that last question if I can. This is obviously a wide national issue. What on a local basis can we do to try to lessen the surge, stop some of those issues becoming a big problem further down the line? Is there anything on a local basis as a local council practically that we can do to help?
So it depends on the issues. I think there are, in terms of ASD and ADHD, I would refer to my point, which is about we've got to work together on getting a right public health message across to parents and families to recognise the diagnosis isn't the way that you would unlock help, and we need to work with our schools to do that. In terms of the other real challenging area, which is probably anxiety and just being really clear about anxiety and depression, I think it's all about trying to get that first response right, and so we are already working with colleagues in the local authority about trying to get that investment and support in place at our schools and at our primary care GP level, that we can spot it earlier and not let it get so big that it needs a referral into our CAM service. Because the quicker we can help people, the more likely it is they're going to get the help that would solve it, rather than it becoming entrenched and becoming a very difficult issue then to work with when it gets into CAMs. So that kind of focus and investment from all of us, both financially, but also more about a sort of hearts and minds, that this is something we need to do together, and it's not just a health issue. As we know, it's an issue that cuts across our social care and our education sectors. So we're getting support, but your continued push for officers to really see this as a priority would be really appreciated.
Officers, do you want to comment on that?
Yeah, I'm more than happy to provide some comment. I'm sure colleagues will also jump in. We are doing lots of work, as Andy suggests, across our system. So working with our schools around graduated approach, around what ordinarily available, which is around what are the things that are in place and can be unlocked within the school, regardless of a diagnosis, and therefore before needs further escalate. We're beginning to do some work with schools in terms of therapeutic thinking, which is partly around understanding behavioural responses within schools and therefore how schools manage and therefore can continue to support students. So there is a big relationship and a big piece of work that we're doing with schools. As Andy says, there's still very much more that we need to do as a system in order to make sure that the support is available and that actually the messaging that actually you don't need to wait for a diagnosis, a formal diagnosis, to unlock help is a really, really key one. But clearly we've got to make sure that professionals are ready to be able to deliver and provide that appropriate help and support at the appropriate time and level.
Thanks, Sal. I'm only a guest on this committee tonight, but I'm sure the committee members will pick that up. Thank you.
Thanks, Jim. Very good question you raised. Rachel, would you like to put your question?
Yes, thank you very much. We're obviously a relatively wealthy borough, so it's quite interesting to see that we have relatively high levels of problems with mental health. And I've got two linked questions. Do we know why that is, and are there particular groups who are particularly at risk? And that could be in terms of income, parts of the borough where the children are living, gender. Is there a particular group or groups that are at risk? Thank you.
Sorry,
I'll be honest.
Can I just check? Hang on a bit. I think I thought you were Rachel Burgess. You're not.
No, it's Rachel Bishop.
No.
Sorry, yeah. I did hear that earlier.
Yeah, because you've just on as a guest, so I can only see Rachel. So I apologise for that. Go ahead, Andy.
Well, I was going to be really honest and say this. What you're asking me is probably stuff beyond my ability to answer. I think it's something that we probably need to invite public health in, give a comprehensive sort of view on. Because in a sense you need some epidemiology and you need some kind of really good analysis that you're asking for, which I think are very good questions. What's driving the demand upward in that respect, which is a national phenomenon. So I think people are scratching their heads what's going on, and I think there are all sorts of theories running around why we're seeing an increase in mental health, both in the children and the adult population. At-risk groups, again, I think it would be really interesting to ask from a perspective of looking at a Wokingham level public health data, what it is that's telling you as a committee about what's driving or factors that maybe are driving it, whether it be inequalities data or otherwise. I think it's so I'm sorry, Chair, I think it might be easier that we get maybe that question over to a public health expert.
Yes, we could look put that on the forward programme at a future meeting.
Thank you very much, Andy.
Want to follow up?
No, that was I had two questions there, and thank you very much for looking into that in advance.
Okay, Pauline, would you like to, Councillor Pauline Simons, would you like to ask your question?
Okay, thank you very much. I've got two questions actually to Andy Fitton. Like David Hare, I was very concerned to hear that the waiting time is actually going up, and that length of time is enormous. For a child who's got a mental health problem, time is very short, and it can very, very quickly escalate into something really disastrous. I was quite interested to hear that you're saying that it's no longer necessary to have a diagnosis before starting some sort of intervention. Particularly, I would imagine that the schools are the place where they would see a problem first. And I don't just mean the head of pastoral care, I mean particularly the class tutor, because they see the child first thing every morning and they can soon detect if there's something wrong or that child is upset about something. So my question is, what sort of training are teachers in general going to be given about how to spot a mental problem and what to do about it to intervene at a good time?
So we offer a training called Pet Care, which is basically about trying to understand approaches to psychological support to children. And Sal's already mentioned therapeutic thinking skills, so maybe Sal will come on and talk about that in a moment. But our training is very specific. So there's 2 levels. We do a general offer of training out to the whole school that gives you a chance to understand general mental health and what to do about it. And then after that, with particular key staff within the school that will take a lead on mental health, we would be offering, I suppose, condition specific, be it anxiety, be it eating disorder, be it ASD based training. So that would often be with particular staff members. So we offer a whole school training plus specific modules that sit above it in that respect. And critical to our mental health support teams will be that dual approach of whole school training and lifting the knowledge and confidence level of everybody who works in the school in all positions. And they're also about putting some expertise training and support alongside a few key members of staff to funnel that information correctly so that they can then do that second level of support whilst they're in school the whole time, because our staff can't be there the whole time. That's what we offer.
That does sound good, but how can you be sure that all schools are going to access it, primary and secondary?
Well, we can't make schools do it. We offer it, and we're working hard to try and make that offer as around all schools. So, I think the critical question would come back to our college in education, our educational psychologists, who would be absolute critical factors who are coming in and out of the school the whole time to persuade them of the importance of this particular topic within their school cohort. I think Sal might have more to say on that.
Yeah, happy to. Mental health and schools teams will be doing whole school approaches. As I mentioned earlier, there's an approach that we're working to deliver to all schools and senior leadership programs. In fact, our school improvement team is leading on much of this development alongside our education psychology service. And actually, I think if I can ask Gillian to come in, she might be able to give you a bit more of the detail in respect of those programs, if that's okay. Gillian, do you want to jump in at this point?
Yeah, absolutely, Sal. So we have a couple of programs. So we're looking at introducing therapeutic thinking in schools, which is a recognised approach that puts a protective thinking around all children in schools. And a number of our schools have already indicated that they would like to move forward with this. And we had something like, I think, 25 schools attend an initial fact-finding session that we held in July. And we're just trying to work out how we, at the moment, deliver the training to schools in a COVID secure way and engage with the national trainer to be able to help schools move forward in the way that they want to with that. But what we're also doing at the moment is delivering from next week the Wellbeing for Education rollout plan, which is a DFE programme that they've sponsored and funded local authorities to be able to do. We're working jointly between the School Improvement Service and the Educational Psychology Service to double hand delivery of this particular programme. It's designed to help education settings use psychological education in order to better manage, in the first instance, the impact of the virus, but then secondly, to enhance the well-being for all children and staff through social scaffolding, and to help young minds to continue to learn and grow and support the staff and the families in that process. So we're inviting senior leaders to attend 2 sessions between now and Christmas. Those sessions will provide those senior leaders with the training materials to take away and to cascade back to their teams in school, so that all staff across the whole of the Wokingham area can be well trained in these strategies and aspects. And then following on from that, during the spring term, we're going to be running specific sessions that will focus on anxiety and bereavement and other particular topics. So that's just a kind of really quick overview of a couple of the things that we've got in place. I hope that's helpful.
Thank you. But just a follow-up question to Andy from that before I come to my other main question. We've heard people mention several times all children. A lot of children are in private schools and they also have mental problems, and they don't necessarily have the same sort of access to support that children in state schools do. So, Andy, will you be offering the training to teachers in private schools as well?
So we have offered the training into independent schools, yes, when it's been asked. We don't do that through the local authority, but our CAM service does that directly on request.
Why is it on request then, rather than on your own initiative?
I suppose it's because we don't have the natural way of delivering into those in the same way we do with the councils, because they're independent. So the easiest ways into the mainstream school is often through the local authorities. If you'd like to suggest a way that we could contact the private schools directly, I mean, we don't have the kind of perfect capacity to do the outreach that you may want of us. This is a limited service in time and capacity. So when schools have asked, we have actually offered that.
Well, I think the obvious way is simply to write to the head teacher and explain what you're offering, because private school teachers have just as much training as state school teachers. So that would be the easiest way in.
Private schools are invited to be part of the partnership. So, the governance arrangement I described earlier. So we have traditionally had private school representation on that group. And so the offer is always open to them. So that's there. What I'm trying to say to you is that it's just the capacity of somebody to do all that work, to write to every single private school in the area. It's going to take time for the provider to do that. And it's not something that we've necessarily had the capacity to do in the past.
So we're choosing which children to help then? Anyway.
No, not at all. Not at all. I think that's an unfair characterisation of what I've said. What we're saying is that obviously we will work with the people that want to work with us. It's the same within the state sector. We don't actively go out and seek it, but we do offer it. So when people ask, we will meet their need.
Maybe need to be a bit more proactive in offering it to private schools then. Can I come to my second question, which is in the context of COVID and the fact that we're offering online assessments and therapy. I'm sure it's adequate, but is it as good as face-to-face work with children?
I think it's a mixed position. We've only been doing it for a short time, so the evidence base isn't really clear yet. The initial feedback is mixed. Some children and young people have really appreciated it and it's worked really well for them. Others have decided it's not for them and said that they're prepared to wait for their therapy to be able to start face-to-face again. So all I can do is give you the feedback. An effectiveness rating that needs to be more evidence-based, and we've only been doing it for a short period of time, so I don't have that effectiveness evaluation available right now.
Okay, no doubt you will be evaluating it at some point.
Well, yeah, our provider will be, yes, absolutely. And what we have, the initial recognition is that it won't be one thing or another going forward. So if you look at other providers, others that have done is that they have a mixed offer going forward. So if you look at, for example, talking therapies, there is a mixture of offer. We often offer adults to start their talking therapy in a digital way, which actually it means that they can start their therapy without waiting for a face-to-face contact. But if it isn't working for them, then they can ring straight back and say, I've had enough and I want to move on to a face-to-face contact. I suspect we will go to a similar position with other forms of therapy that it works with. So take anxiety and depression. You know, you want to be offering them an immediate solution or a way forward. They can do some digital work. And then it doesn't mean that you don't stop them seeing a face-to-face person in the end, but actually at the end that they may not need it because they've worked through what they need on a digital offer, and you can move to your next step.
Fine, thank you very much.
And actually, you mentioned that, you know, some children and young people have opted out and said they'd rather wait. What proportion is that?
I don't know. I don't know that information, I'm afraid.
Or is it sort of 50-50 or?
I genuinely don't know. I don't know.
I'd just be concerned if a large proportion, the majority were opting out to wait till later, because that would be of concern.
Yeah.
And is it the child or young person or their parent that makes that decision?
It depends on the age of the child, doesn't it? You know, who's making the decisions with the therapist, and who helps that support. So there won't be a blanket rule around that. It will be done on a case-by-case basis.
Thank you. Any other members have a question for Andy? Okay, in that case, Andy, I'd like to thank you very much. An excellent report, which has given us all a lot of insight and things to think about.
Can I just check?
Thank you very much to everyone from HOSC who joined us this evening.
I was just going to check, Councillor Swallow. I think I've taken 2 actions. Can I just double check that they're the ones from the minutes? I think I need to give an update on the anxiety and depression pathway, why that is so much a longer wait. And the second one is about the confirmation of wait times for ADHD. Can I just check with the minute taker? They're the 2 actions that I've got. Are there any others that you had for me?
Can I get back to you once I've written up the notes? And if there is anything else, I'll let you know.
Thank you. I apologise if I've missed something else.
Andrew?
Yeah, could we also get some information about what sort of monitoring and evaluation of COOTH there will be?
Yes. So what I was going to suggest with that is that you've got an officer within the council, a colleague called Kim Wilkins, who'll be joining me in that monitoring. So I would suggest, because you're a co-funder in that as a council, so I suggest that actually, if possible, please, if we could ask Kim Wilkins to take that action rather than myself, because that can be fed through much more easily than I do that myself.
Yeah. Thank you.
Okay.
Well, that's absolutely fine. I've made a note.
Kim is in the meeting tonight.
I've made a note, councillors, to pick that up in our meeting with COOTH next week. So I'll take that forward.
Thank you, Kim. I think a member, and I do apologise, I can't recall which member, raised concern about ADS, that they'd heard it wasn't being assessed at the moment.
I think it was ADHD that it's suspended.
ADHD.
And I said that I've not been given. I've just checked my emails again today while we were waiting, and there's nothing in my email trail that tells me that's true. So I'd like to be clear that they have not, as I've been told today, that hasn't been suspended. So I think we should take that as just a rumour, and that probably best to squash it and just say until we get told properly, we should accept that referrals are still open.
Okay, but you can come back to us this week if you hear anything subsequently.
Yeah. If I hear differently, I absolutely will let everybody know. I promise, and I'll do that through Sal if that's okay. Just because I think it's important that the council would know straight away if we've suspended a referral pathway.
Yeah, thank you very much, Andy. Right,
no worries.
Okay. Members, we have the Deputy Executive Member for Children's Services here. Because we did invite the lead member, Councillor Clark, to attend, and she wasn't able to. But when we published the agenda, we weren't aware that Graham was going to be attending in her place. So if everybody would be happy, I'd like to invite Graham to give us the lead member update and take some questions. Okay. Graham.
Thank you, Chair. I wish I was able to, actually, because I didn't come into this until very late. So I have no update to give. Apart from anecdotally, this afternoon I heard that teachers and students aged over 11 must wear masks to prevent the spread of COVID in communal areas. But I'm afraid I have not been briefed with an update to give.
Okay, well, members, was there anything that you would like to have information on from the Deputy Executive Member? I can't see any hands. Okay, well, thank you very much for attending, Graham. It appears that, well...
It's very interesting to hear what's going on. Thank you.
Okay, thank you very much. Right. Okay, back to the agenda then. Item 32, we're looking at the performance indicator for children's services. Which officer is attending tonight to go through the data with us?
That will be me, Councillor Swaddle. That's Nick.
Nick.
That's correct. Hello.
Okay, Nick. So we'll do this the way we usually do it. So if we'd like to look at the first dashboard, is there anything you'd like to highlight to members?
Sorry, I'm just trying to catch up in my.
Oh, would you like to share your screen, Nick? Please feel free.
Yeah. Okay, if you like. Yeah. Hold on a sec. Share content. Okay, can you all see that?
Yes,
we can.
Yes,
thank you.
Brilliant. So, okay, dashboard item 1 then is the education, health and care plans. So we've seen a slight drop in numbers in Q1 of those in borough, and a slight rise in Q2, not Q1, and a slight rise in Q2 of those out of borough. And overall, our EHCP numbers are up 17% this time against this time last year. So there's been quite a significant increase in EHCPs. In terms of timeliness, then, we have sort of dropped in Q2 to 72.1%. When we've looked into the reasons behind that, there are varied reasons. In some cases, parents have requested that additional time to feedback or submit evidence. In other cases, professional reports have been received late. But where schools cannot be named in a plan, we've delayed issuing that plan until such time as they can be. So that's impacted on timeliness as well. The focus of the Task and Finish group and the work of the SEM board is on the quality of EHC plans and making sure that they're issued within timescale where possible. And that's obviously a big focus of the service. And against the national context, statistical neighbours is 61.5% for EHC plans issued in timescale. So despite the dip in Q2, we are still above our statistical neighbours for that. Would you like to ask questions on this dashboard now, or do you want to wait to the end?
Apologies, I was muted. If members have any questions at this point, do raise your hands. Well, I can't see any hands up, so let's move to dashboard 2.
Okay,
Thanks,
great.
Nick.
Thank you.
Chair, David
sorry.
and Abdul just started.
Yeah. Okay, David, please go ahead.
Thank you. I'm looking at the EHCPs issued within 20 weeks, and why has it gone down in this quarter, although the number of EHCPs has also gone down? Therefore, last quarter was a very good one, but why has it gone down when you got to a good level and not being kept at that level?
If I may respond to that one, Councillor Hare, there were some particular issues in quarter two that have impacted on the 20 weeks performance, as I understand it, of the numbers of children relate to 12 cases out of, I'll need to find the number, but I think it's 12 out of about 48 cases that the EHCPs were not issued on time. As I understand it, at least 2 of those cases were children that had moved into the borough, and there was a late notification to our SEND team that they'd moved into the borough, which meant that their EHCPs that had been started with a different local authority and then transferred to us meant that there was a delay. And I also understand that, unfortunately, one of the staff members that was supporting, I believe, 5 or 6 of these cases had a family bereavement during the quarter that impacted on their ability to support. There were some instances with delayed reports, as Nick highlighted earlier, but we have got a very clear plan of action to make sure that we can re-improve performance as we move into quarter 3.
Thank you.
Okay, Abdul.
Thank you, Chair. My question relates to EHCP out of borough. So if you see quarter 1 is 404 and quarter 2 is 427, is this basically the same people, but only a couple of numbers has gone by, what, 7 or just fractionally more? If you know what my question is, it's basically the same, 400, 400, 427. Are they the same people, or is it a different children?
It will be an increase, I believe, and Nick will correct me if I'm wrong, that suggests an increase of 23 children in quarter 2 that have gone into out-of-borough provision, in addition to the 404 that were detailed in the quarter 1 figures.
Yeah, thanks, Al. I think it's important to note as well that if children wish to go to college, then the fact that they are at college will mean they're an out-of-borough provision, because we don't have colleges in Wokingham. So it's not always that we've been unable to place someone within Wokingham. It could be that they've just naturally left school and gone to college outside of the borough. Okay, are you happy for me to move on to item 2?
Yes, please.
Okay, so item 2 is about early help. In quarter 2, we've seen a large number of referrals to early help. They've actually seemed to have borne the brunt of a sort of, I don't want to say surge, but where kind of schools have gone back and life sort of began to return to normal in quarter 2, it was in early help that we really saw those numbers increasing. But despite that, the average length of time in assessment in days between referral and assessment completion actually fell quite a lot, quite significantly in quarter 2. So they were sort of completing assessments in a timely way, despite the increase in referrals to early help. So that's quite an impressive picture there, I think. Does anyone have any questions about early help?
Andrew.
Yes, thanks. I was also really pleased to see the further fall in the average time taken between referral and assessment completion, especially, as you said, given the significant increase in the total number of referrals. So that is a really positive thing. I was also pleased to see that there's an internal review taking place within Early Help. I'm just wondering whether you're able to give any indication of what stage that review is at and when it might be completed.
Evening, it's Adam here. Shall I try and respond to that? So there is a early help strategies still waiting to be signed off, and then once that's concluded, there will be a task and a finish group that will be looking at some of those activities. But that has been delayed because of COVID.
Shall I move on to front door?
Unless Andrew wanted to come back on that.
No, that's fine. Thank you.
Okay. Yes. Social care front door, please.
Okay. So where I mentioned that referrals into early help had kind of risen quite a lot in Q2, we've seen a steady increase of referrals into children's social care across Q2, but it's not up to the levels that we would normally have expected. It's just slightly below. If you compare to Q2 last year, there's still significantly fewer referrals. But having said that, the percentage of referrals which are repeat, so the children that we've seen a referral for in the previous 12 months, that's fallen in Q2, which is encouraging because you would think that in the unusual circumstances in which we're living in at the moment, you might expect some families to kind of reappear on our books, but that hasn't been the case. So we're pleased about that. Timeliness for assessments in Q2, as with early help assessments, has improved. So, that's quite an encouraging picture as well. I'm happy to take any questions on the front door.
Andrew.
Yes, thanks, Nick. I'd like to pick up on what you've just said about the number of repeat referrals. And it is good to see that figure has fallen a little in the past quarter, but it's still over 1/5 of referrals are repeat referrals within 12 months. Is there any evidence that the pandemic is having an impact on the reasons for the repeat referrals? For instance, have some of the reasons perhaps become more commonplace? And also, is there any evidence of increasing complexity of some of these cases, specifically with repeat referrals?
Adam, do you want to? If you anything you want to say about that, or
I think there is. I think over the last year, probably pre-COVID, there has been an increase in complexity that isn't COVID linked. In terms of what we're seeing in the front doors, we're seeing a lot more items or children being referred to us, but not necessarily progressing into a referral or a response that children's services would make. And that then could be linked to the increase in activity that our early help is having in terms of those being signposted back out to that service.
Okay.
Yep. Abdul.
Thank you, Alison. In your report, you've got here large number of open cases to close during lockdown quickly. Can you give us a little bit more details? What does that tell us?
Sorry, I'm just
on page 31.
That line. Bear with me, sorry. Page 31.
It's at the bottom of page 31. What action is the service taking?
Oh, right. Okay. Sorry. I still can't see it. Oh, sorry. Yes, there we go. It's the first one, isn't it? So I think what we're trying to say there is that cases are not lingering open to children's social care when they need to be closed. So there's kind of prompt action taken to make sure the case closes at an appropriate time, as opposed to kind of staying on when it doesn't actually need to be open to children's social care.
And also during the sort of depths of lockdown, where there was a reduction in cases progressing to referral coming through, it also freed up some capacity to enable us to deal with some of those cases that we may have been open still in the front door part of the service.
Okay, thank you, Alison.
Okay, shall we move to the next dashboard, please?
Thank you. So that's child protection. So we have seen a kind of fall in the number of child protection plans. We believe that's linked to the lack of referrals, well, not lack of referrals, but significantly fewer referrals that we've seen coming through over the last 6 months. We've not had anybody coming back onto a child protection plan that had previously been on a plan in the last 2 years. And if you look at this time last year, we were at 24% of new plans with children that had been on a plan in the last 2 years, and that's come down to 0. So I think that's kind of proving that the plans that we are ending appropriately with an appropriate action plan in place to ensure that these children don't need to come back onto child protection plans. So that's really good news. There's been a very, very slight dip in the number and the percentage of child protection visits that are within timescale. Now, the timescale that we operate to internally is every 10 working days. Now, that's not a statutory timescale, and not everybody would try to visit within 10 working days. But the fact that we're achieving such high percentage there just shows the focus that social workers are having on visiting our child protection children. And even despite the kind of difficulties of going out to see families at times during the pandemic. And there's a table down here that I'd like to show you. This shows the number of visits that have happened over the last 4 months. F to F means face-to-face. So you can see that the vast majority of visits to child protection are face-to-face, with only a handful being virtual. The decision was made early on in the pandemic that where possible, child protection visits should be face-to-face. But obviously where you've got families self-isolating, it's not always achievable to have 100% face-to-face visits. So there's going to be a small handful that are virtual. But I think it highlights the commitment across the service to visit children in quite difficult circumstances. The DfE have also been introducing new sort of metrics that they're asking every other week. And one of those is the percentage of child protection cases where they're seen or contacted every 4 weeks. We're happy to report that it's always 100%. All of our child protection children are visited and contacted within a 4-week period. So
can I just add that other table that Nick just showed there on the face-to-face, that was a query and question that came up in the last one of these meetings in relation, and I think I gave a response which was based on having the data before me, and that just clarifies that position in relation to the difference between the face-to-face and the virtual visits.
Thanks, Adam. So any questions about child protection?
I'd just like to say thank you very much for giving us the data, breaking down the face-to-face and virtual visits, because I think that was misreported in the local press to make it sound, of great concern when during the last ONS meeting we had reassured by your verbal explanation about how many visits were being done in person rather than online. So thank you very much for providing that data, Adam and Nick.
Thank you.
Any other members with questions? Okay, let's move to the next dashboard.
Okay, the next dashboard is children in care. You can see that there's been a slight decrease in children in care in Q2, but not nearly the sort of decrease that we've seen for child protection cases. The visits to children in care has remained consistent. I think in the official agenda pack, that's a red down arrow, but that's really because it's a fraction of 1% difference here. But for all intents and purposes, it is stable. The good news here is that the percentage of children in care who've had more than one allocated social worker in 12 months has fallen quite dramatically to 46%. Obviously, you'd want as few changes of social worker as possible so that the children in care get the kind of stability of relationship with their social worker. We've provided some narrative around why people would change social worker this quarter. 11 of the 45 children who have more than one allocated worker are in the process of transfer to an appropriate team. That's where they kind of move from one team to a longer term team. One was transferred back to a social worker with whom the young person had formed a good relationship, so that was felt to be a kind of very positive change there. 2 children were obliged to change due to a social worker's ill health, so that was unavoidable. And 6 changed because the social worker was internally promoted to assistant team manager. Like the child protection figures before, we've got a breakdown of the face-to-face and virtual visits to children in care. Now, the important thing to note here is that back in the summer, we were still doing more face-to-face visits than virtual, but there was still quite a significant number of virtual visits happening. Now, in September, the virtual visits were used very sparingly and children were being visited face-to-face. And you can see that the numbers of face-to-face visits in September is far higher than back in June. So that was something we wanted to highlight as well. So any questions about children in care? Sorry, Adam.
Add a bit of context to that. So we still have some children that are placed at distance out of borough, and some of those were in areas that were under recent lockdowns under Tier 3. And so we have still used virtual visits on some of those that are at distance in areas that we sort of balanced up whether we should be visiting or not in light of the COVID context.
Thanks, Adam. So any questions about our children in care?
Well, I can't see any hands going up, so thank you for that. Nick, let's look at the next dashboard.
Thank you, Chair. I shall move on to care leavers. So we are in touch with 91% of our care leavers, and that's 84 of 92. I think we've been asked to include numbers, so we've tried to do that in the narrative. There has been a slight increase in the percentage of care leavers who are NEET. That we think is linked to the general economic situation that we find ourselves in at the moment. But it's still lower than where we were this time last year. So although it's had an effect, the measures that the care leavers workers are putting in to keep people in education and training are obviously having an effect there. The percentage of care leavers in suitable accommodation is very high, it's 97%. The reasons behind those that aren't in suitable accommodation, I think one of them is in a bed and breakfast by choice, where they've been offered housing locally, but they don't want to live in Wokingham, so they've chosen to be in a bed and breakfast in the area they do wish to live in. One of our care leavers is about to leave custody, and some accommodation has been sorted for them already. Any questions about care leavers?
So we've got 2 living in bed and breakfast, and you said one of them's there by choice. Why is the other one there?
I think right at the end of the quarter there were 2, but I think very early October that changed to 1.
Oh, well, that's good. Thank you.
No problem. Any further questions on care leavers?
Yes, Andrew.
Yes, thank you. I'd also like to ask a question about the care leavers who are NEET. I see the aim is to have less than 20% of care leavers NEET. Are there any specific additional actions being taken besides the monthly meetings with the care leavers to try to support the more than 1/3 of care leavers who are currently NEET, and especially to try to address some of the specific challenges relating from the pandemic. And you mentioned, the really difficult labour market at the moment. Are there any specific additional new measures being taken to try to help these young people?
So the role of the virtual school is due to increase, or plan to increase soon, to cover that fuller age range from 16 up to 21, rather than focusing on the school ages at the moment. And we're also, I think there was a question earlier in relation to apprenticeships, and we are looking at how we can develop those sort of ring-fenced or apprenticeships for our care leavers.
Excellent, thank you.
Okay, if you're happy, I'll move on to the next one.
Yes, please.
Okay. So the next dashboard is children missing from home and care. I think from the figures you will see that the effects of the pandemic in Q1 and Q2 have not necessarily been borne out in the number of children missing from home or care. I don't think there's any significant information to show that the increased kind of pressures of family life, I suppose, has forced people to go missing anymore. Our percentage of return home interviews carried out on time has fallen slightly, and we do endeavour to offer return home interviews to anyone who is found after going missing, but it is up to them really whether they have it or not and when they have it. And actually the take-up is reasonably low. The number of children missing from education has fallen to 2, so that's those not currently on a school roll, and that's obviously a lot lower than where we were in 2019-20, which was 16. We've had no permanent exclusions at all in Q1 or Q2. That's possibly not surprising, given that a lot of children weren't attending school in Q1 and Q2 encompasses the summer holidays. But even so, I think that's an encouraging picture. Any questions about that?
Nick, where it says children missing from education, and you've added the detail not currently on a school roll, that also means not currently on a schoolroom or being educated at home?
Yes, that's correct.
So perhaps if we're going to add a note to that, it should also include the children being educated at home, because we don't currently have a register of those children that you can share with us with the numbers, do we?
We do know the numbers that are electively home educated.
Okay.
Which we could add to this dashboard if it would be of interest.
Well, I think it would be of interest to members to see if that's increasing. You know, whether parents are choosing to educate their children at home because they've got, I don't know, fears about COVID. But I wouldn't want to include it on a dashboard saying children missing from home, if you see what I mean.
Yes, no, I understand that. Okay, well, we could have a look at rejigging the dashboard items and their headings.
I think we might simply just need to rename the dashboard, because obviously the number of permanent exclusions has got no relationship with the number of children missing from home, does it?
No, you're absolutely right.
That's just been popped in.
Yeah, I think this is.
But yeah.
Sorry.
I think we're trying to put quite a few different things together in this. But I am pleased to see that you've added the number of permanent exclusions. And I'm very pleased to see that we're on 0 in the last 2 quarters. Something we had asked about when we're looking at the number of permanent exclusions is to also provide information on the number of children permanently excluded who have special needs. Okay. So if we do have any children in the future, if we could have that information as well, please.
Of course, that's fine.
Does anybody else have a question? No? Okay. Let's move to dashboard 8, please.
Okay, so this is the final dashboard. This is Children's Services Workforce. It's quite good news here because the 12-month rolling turnover of permanent qualified social workers has decreased to 8%. It was 10% in the last quarter. Obviously, the lower rolling turnover you have, the more stable the social work staff and the better the relationships they have with our social care cohort. So that's good news. The percentage of agency staff has remained stable. That's at 30%, and that's significantly lower than it was at Q4. So again, that's quite good news. Any questions on that?
Yes. Yeah, can I just start? Oh, sorry.
Sorry, Pauline, go ahead.
My
go ahead.
has disappeared. So shall I go ahead? There's just a quick question.
Please, yes.
The agency staff that we've got, are they all fairly long term, which in its own way will give stability to the children?
If I could just come in there, so I think we try and separate the difference between, as you have there, stability and permanence in terms of the workforce. So we do have a locum workforce. We've had some that have been with us for quite a period of time. So we do have stability within that locum workforce. But what we're wanting to move to is a permanent workforce that are employed through the local authority.
Yes, of course. But I mean, it's okay to have agency staff as long as they're with us for quite a while.
Yeah, they do meet a need that we have and a demand, especially around sickness cover as well, and maternity cover. So for example, but we do have a number of vacancies that we are looking to fill, and we've recently we are running a recruitment campaign ongoing, and it has been, I think, been impacted by obviously the national context. We have recently recruited a number of ASYEs, which are newly qualified social workers, which should be joining us over the next few months.
Good.
Okay, Abdul.
Thank you, Chair. Pauline asked the same question, nearly what I was going to ask. It is a bit concerning when you see 30% plus agency staff, as we all know, it costs a lot of money to the council. How long does it take for them to take it on board as a full-time? How long they have to be with you in order to take them as a full-time?
Sorry, I'm not clear the question, because you can convert a locum worker to be permanent if they wish to. It's there. It's around whether they want to join the local authority on a permanent basis.
Okay, now I'm just saying, percentage is quite high. I was wondering what other neighbouring councils are recruiting or doing. The 30%, 30+% is.
So it is a national challenge in relation to recruiting permanent social workers. If you do a sort of research on it, there's a number of articles in The Guardian and other publications that indicate different range across different authorities. I think some authorities have been at 60%, others are very low, with a very small percentage of locums. It takes time to reduce, and what we have is a strategy in place to try and address that. We now have a recruitment and retention steering group, and it's around how we can, I suppose, develop the offer, but also creating it as a destination that workers will want to come and work at Wokingham, because we are competing with a number of other local authorities which are very close.
So in terms of recruitment, what strategy have you got in the future?
What strategy?
Yeah.
It's about creating a supportive environment with manageable caseloads, where workers feel supported and they can develop their practice model and have career opportunities.
Okay, thank you.
Right, does anybody else have any questions on the dashboard? No? Well, thank you very much, Nick.
Thank you.
And oh, sorry, we do need to officially vote to note these two. Is that right, Lucian?
Sorry, say again, Alison.
Do we have to have what's the record? We just simply accept these, don't we?
Yes.
Yeah.
Yes, I think it's for voting. Yeah.
That's okay. So, item 33, Children's Services response to COVID-19. clearly, having looked at the performance indicators for the most recent quarter and the one before, we have discussed some of the information drawn together right across children's services in this report. So we do have Adam here from social care and education. Adam, did you want to say something before we take questions?
I suppose just an overview here. Obviously, this when we were doing this, it was pre the current lockdown. This was sort of between the September 22nd announcement with the sort of tier system as well. And this is sort of looking back from the March bit with lockdown and how we've sort of unravelled some of those services or how we varied those services during that period and carried on delivering a lot of key services. And I think the one I highlight in here is that we sustained offering a residential overnight respite service for children with disabilities in the borough. And also in here is a section where we've been doing some audit work from our quality assurance department, which is looking at our practice and service delivery. So that assurance really around what we were delivering during that time. And sort of looking at this now, it's interesting because obviously we're preparing and planning to enter another period, well, in it now, another period of lockdown with similar restrictions. But what's different this time is that obviously schools are still running and we're still delivering, wanting to sustain services at a higher level than we did when we went into lockdown in March. But yeah, happy to take any questions.
Adam, is there what are the key things that you felt you learned from the lockdown in March that you are putting in place now at the beginning of lockdown 2?
I think it was I think from March what was very notable really was the ability of workers very quick to adapt to working in a new way from home. And whilst we introduced and we were allowed to under the Department of Education guidance, which put in place some variations to the statute, we were able to deliver some of our services differently. And when we look back at that, and that data looking back in June, it was still reassuring the level of activity we were delivering face to face that we were doing, and we developed quite early on risk assessment models that would assist us in planning around how we responded. Because of course we have the two duties really. One is to keep our workforce safe, but the other is to deliver those statutory duties and keep children safe. And it was always a balance when we were looking at how we delivered our services around how we got that balance right.
Great, thank you. Andrew.
Yes, thank you. Adam, you mentioned, that of course we are now in a second lockdown and, there is a second wave with rising numbers of uncertainties. My question is specifically about schools. Okay, I know that there continue to be an enormous amount of supports in place for schools, but are there any things that might happen, including perhaps some things that may not have happened before that would particularly worry you and for which you feel schools and the council might not be able to cope particularly well with? And the second question is also relating to schools and attendance data. Now, my understanding is that attendance rates are actually very good and have been since September. But my question is the data on attendance being continuously analysed to determine whether there might be any particular groups of children, for example, by gender or age or ethnicity, particular localities within the borough whose attendance is being significantly impacted upon by the pandemic? Do we actually look at, collect, that attendance data in that kind of level of granularity?
I'll probably ask Sal to address some of those around the schools and the data. For the cohort of children that we work with, obviously we have a cohort of children who are in our care, looked after children, and the virtual school and our social workers will support them in continuing to attend school throughout, which they have been. And obviously during the previous lockdown, we were able to have a lot of our children attend school, and that number developed and grew throughout the lockdown period. But in terms of the current data and numbers, I'll need to look for Sal if he can respond to that, if he's able to.
Yes, colleagues, I'll try. Unfortunately, I've been kicked out of the meeting on my laptop, so I've had to move to my mobile phone. I do apologise. In terms of the data that we use in terms of attendances, each school on a daily basis provides information on its attendance back to the DFE, and that data is then returned to us as the local authority so that we can track. As Councillor McAbrough says, actually our attendance rates at the moment are quite high. We're looking at certainly in the 90% range for all attendances. We're in the, I believe, in the 90% range in respect of children with EHCPs, and I think we're just shy of the 90% range for children that are open to children's social care. And I understand that these proportions fare favourably in respect of comparison to other South Eastern regional partners or boroughs. The data as it comes through isn't cut, as it comes through to us, isn't cut to the level that will identify the particular groups that you refer to, Councillor Mickleborough, such as gender, ethnicity, etc. However, as it's delivered to the DFE based on school attendance registers, that data is available, and I know that at a national level they are looking at the impact as it relates to attendance. At a local level, we have been working with schools around the direct supply of that type of intelligence to us, but we ceased to ask for it when the DFE started to ask for it on a daily basis to them, and that was purely because of all of the other pressures that schools are facing. We didn't want them to duplicate activity. So we do our best to try and understand the impact on particular groups, whether that's about socio-economic groups, as I say, ethnicity groups, or to understand the gender balance, but we don't have that direct data source upon which to work. So we are working basically on the intelligence through the relationship that we do have with our schools, if that's helpful.
Yeah, very much so. Thank you.
Okay, Guy?
Thank you, Alison. Couple of questions here. Whilst I was skimming through the report, there was one aspect that I didn't see much reference to, and that was basically support for parents and children. Well, support for parents who have infant children. So basically preschool age, as it were. I don't see anything other than mentioning a brief element about the two children's centres, Red Kite and I forget the other one. So question on that is there anything being done in that aspect from the council to support younger children, preschool age children? Because I just did not see that in that regard, unless I'm completely blind.
So the early help services have, back in the first lockdown, they moved to offering virtual support to lots of families they were working with, and that will include they were working from the children's centres previously. So we were on a trajectory looking at getting those staff back out to the children's centres, and we're now on a plan for the health visitors to return to those children's centres to deliver that service. But they haven't ceased delivering, they've just changed the way that they were delivering that. So a lot of the group works that were taking place in person moved online, and a lot of the one-to-one support that was taking place in person moved online or through virtual means of delivery. So that's still in place, those families, and that would be what would be classed as a targeted services rather than universal.
Okay, and was that advertised? Because I did not see personally any advertisement on that regard. Is it when you say it's targeted, was it being communicated directly to the parents in that aspect?
So when we say targeted, that's on that scale of services, universal, targeted, and specialist. So that would be targeted services to families that have been referred or working with early help services. The majority of our children's centre activity is targeted services, pre-COVID and during COVID.
Okay, so it's being communicated in that regard. There was one other aspect. I'm just trying to remember where I put the note for it. With the yes, that was it. For the support to the school and settings, again, this is going back to preschool issues. I know there's a lot of nurseries and both in school sites and outside school sites. Has a similar offering from the council been given to them to support them being reopened and supporting them through the opening scheme as well?
If I can respond to that one, yeah, we do have support, and support's been offered to all of our early years and childcare settings. So that's nursery providers as well as individual child carers around either maintaining their opening or when they are reopening. Again, throughout the pandemic, we have been able to maintain opening to meet the sufficiency needs in respect of children. So where settings have had to close temporarily, we've supported parents to access alternate provision in their local area, so that's still supportive. And then when settings have started to reopen, we've engaged with them to do so. As I understand it, there are 2 settings that have closed during the pandemic period, but I also understand that these are not for COVID-related reasons. I hope that answers for you.
Yeah, that answers it. And one of my other questions was taken, so I am good. So thank you very much, Alison. I'll probably wait till the end of this session, and then I'm going to have to disappear and go build a cot. But thank you very much.
Okay. Thanks, Guy. Abdul, would you like to ask a question?
Thank you, Chair. It's more of a probably something which is coming in the future. This very much so, very like that. I like that 6 underlying principle which is there. Is this something you already started, or is it going to come in the near future? 6 underlying principle, which is on page 44.
So that's the from the government guidance, and I believe that's just rereading that document now. That came out at the beginning of the pandemic in relation to local authorities' response to delivering social care services.
Okay. With our look after children, I'm just a bit concerned how well we're doing looking after them. The disability, especially the disabled children.
How we're doing with our services for children with disabilities?
Yes, please.
So as I mentioned earlier, throughout the pandemic, our resources centre that provides overnight respite has remained open. Whilst the numbers reduced slightly, they have carried on delivering a service throughout, as they are doing now. We also recently reopened the Saturday Club, which supports children with disabilities, and the social work team has been delivering services throughout the pandemic.
Okay, and one probably in my ward in London. Is this in Colesmore Road? Is it? The children.
Bridges, is
that open during the pandemic?
The Bridges, yeah, children's centre. The respite centre is open. Yeah, the residential centre. Yeah.
Oh, that's good. Perfect. Thank you.
Any other questions, Abdul?
No, thank you, Chairman.
Thank you. Right, if nobody else has got any other questions, then we can note that report, which fed back to ONS management as part of our review of the response to COVID-19 across all departments. Right, let's move on to the next item on the agenda. Yes. I've got the title right. Oh, yes. Right, Sal, would you like to give us an overview of this?
Chair. Sorry. If I may, I was going to ask Piers Brunning to actually introduce and take this item, if that's okay, Chair.
It is. I'd just like to remind members that we will be discussing any recommendations that we want to make, having discussed. Okay, thank you. Go ahead, Piers.
Well, thank you, Chair. I've thought for sort of ease of reference, I would break the presentation down into 4 areas. They're the key sort of education phases, I suppose, for us. There's the primary phase, secondary phase, but I've subdivided that into the statutory phase and post-16 and SEND provision. And I thought those were probably the most straightforward ways of looking at place sufficiency across the borough. The primary.
Okay. Do you want to share your Piers? Do
you
want to share your screen?
I can do. Initially, at least, you're just going to see the report that I'm working to, but yes, I can do that. Just let me bring that up. And since it's a lot of text, it's probably more attractive than me, but that's what's happened there. Are you able to see the page of the report? It's not come up for me.
I can see it.
I can see it, but it's not readable. It's too small.
Yeah, that may well be a problem. I'll see. I can blow it up slightly. Hang on. Oh, good grief. Is that a bit better?
Yeah, that's better. I can read that.
Good. Okay.
That's great. Thanks, Piers.
So I'll bring up the primary elements, the points first of all, and I'll talk very briefly to those. I suppose the key message is that for 2020 we had sufficient places. Certainly throughout most of the 2010, that was an area of concern for the borough. In Shinfield, which is probably our most pressured area, it's not a planning area, but nonetheless it's a significant community on its own. We filled all the schools, and that was despite having opened the new Aldergrove Primary School. You may have heard of that or known of it before as being either the Floriat Silver Meadows School, and before that was identified as the Shinfield West School. So they're all the same, and it's the Aldergrove Church of England Primary School and Keys Trust that we've managed to open there and filled it in this year. There are some other parts of the borough that are also relatively close to being full for reception places. Arborfield, it was quite full this year, Wokingham Town West and Woodley. These are all areas where there's a significant house building going on. But counterposed to that, we've got very significant levels of surplus capacity in some other parts of the borough. I'd highlight the north, Early, the southeast and Wokingham Town East, which tends to balance out the Wokingham Town West area. And these are areas that have seen relatively little house building. I'd say that in the longer term, we're going to have all the evidence points to us to having a tension between the underlying population trend, which looks to be slightly downwards in the primary area, and age group, and the impact of the new housing developments. So what we'll be seeing is we'll be seeing stagnation and falling roles in some of the established communities, but we're seeing rising roles, in some cases quite rapidly rising roles, in areas around the major housing developments, particularly the SDL development. And it's likely that we will have to make some adjustment by increasing capacity in line with the long adopted plan for the borough in those major housing development areas. And if we don't do that, we're likely to have large numbers of children that we're going to have to bus across the borough, putting a considerable degree of pressure on the hard-pressed homeschool transport budget, and certainly adding to transport congestion and the borough's carbon footprint. Within the primary sector, we do have some overall pressures in Key Stage 2, particularly years 4 to 6. This reflects the fact that the roles have continued to rise after initial admission to schools. We do have the capacity, and we expect to be able to open new classes in schools which haven't yet opened up classes for those age groups to address that problem. But this growth I talked about isn't going to be sufficient to solve the capacity problem that we've got, the overcapacity problem that we've got in communities like Early in the southeast, albeit it will reduce the number of surplus places as those children age through the primary years. We don't know, we can't say at this stage what the impact of COVID-19 will be on future roles, but it has had a very significant impact on house building and house sales in the borough, and it's been a long-standing feature of Wokingham life that a significant proportion of the roles comes from young families moving into the area with their children. So that's likely to be choked off to a degree for next September's admissions. But it's far too early to know exactly what that will mean. Secondary sector, 11 to 16, we're undoubtedly seeing pressure as we're seeing the primary bulge is working its way through into the secondary sector. This year, we had to offer 25 additional places at Embrook School on top of their admission number to ensure that all the on-time applicants received offers. Now, had those numbers remained at Embrook School would have had the capacity in terms of the classroom spaces, teaching spaces to meet those needs, but actually the numbers fell quite significantly between the offer day at the beginning of March and the start of term in September. And as far as we can see, the bulk of that fall is due to children being withdrawn from school places, parents declining the offers they've had because they're placing their children into the independent sector. In many cases, we know the names of the schools that they're sending their children to, but there's a number of other parents who disappear from the scene, and it's quite likely that they are actually also, by simply declining the offer, it's quite likely that most of those are children going into the independent sector as well. The end result of that was that we had 3 schools with surplus capacity. However, the Embrook School and Wangels College both basically only had 10 places each, and that's a very, very low level of capacity across the borough. Most of the capacity has been concentrated in Forest School. It had 130 unfilled places. And of course, the problem with that is that Forest School is a boys' school. So we have a significant potential challenge, not an actual problem at the moment, with providing places for girls that arrive mid-phase. So that's something to flag up. But we do have room in a number of schools. It would be a matter of agreeing with schools to open additional places. We think the projections indicate that the rising numbers coming through mean that we may well have to agree additional capacity. It's always complex in Wokingham because of the influence of cross-border movement. And what tends to happen as our demand has been rising internally from Wokingham resident students is that the number of admissions from out of borough has been squeezed downwards. But although we've had historically a kind of balancing number of children going to schools in other boroughs, the squeeze hasn't applied to them. That's almost certainly because they have rather different forces and circumstances applying to the children coming in compared to the children going out. For example, we have children going out to grammar schools in Reading and Slough, and plainly there are no children coming in into this borough for grammar school selective education. We are basically expecting that we're going to have growth until mid-2020s perhaps in the secondary roles, but after that we will start seeing the numbers falling away in line with the fall off that we've seen in applications for primary schools. So we've got a bulge situation to deal with in secondary at the moment. We don't have a long-term increase or something that would require permanent expansion or a new school. We may have to put some temporary accommodation in. That is a risk, but we're not going further than that. And the longest term projections that we've got really point to us having falling demand for the foreseeable future. But there is a caveat about the Office for National Statistics baseline projections that I'll come on to in a moment. And there's a note, I say, that new house building will be a key driver. And it's the question for us all is, what does that mean for the population of the borough? And which, at least initially, we're talking about on top of the population projection, but because of the way the projection operates, if we've got very rising numbers of children, then the population projection will start picking that up. And then that becomes self-reinforcing for driving the number of additional houses that the government would expect us to build in the borough. Okay. Post-16, I'd say our most immediate challenge that we've got is because we've got two 11 to 16 schools in the borough. And the question is, are we going to have to put additional capacity in at some point to meet the needs of those students that are coming out? I think our view is that we need, it's a little early to say when we need it. We don't need additional capacity at the point at which Bohunt's initial role comes out of the school. They may have challenge getting the exact mix of courses that they would prefer to undertake, but there's good reason to think there's capacity in the borough's schools and in neighbouring colleges. But that may not be the case in 2 or 3 years down the line. And we want to have a debate with schools about what's the best way forward. You know, is it something we can contain in existing schools? Is it something that that's going to involve local colleges, or is it a case that we will need to open a new sixth form? And we need to make sure that we've also taken into account the need of the borough to try and increase the total number of children who are moving on to level 3 courses, A-level equivalent, so A-levels and T-levels and similar qualifications. Because plainly we have a significant number of students who move on from the borough schools who aren't going on to level 3. And that's what we need to be thinking about in the longer term. SEN provision, this paper isn't predominantly about SEN provision, but we have had a problem with the rising numbers of young people, and there's a particular problem with very expensive provision. You could have 10 children with £100,000 placements, and yes, we do have placements that cost 100 to 250,000, and that's £1 million gone on a very small number of children. So a critical need for us is to try and create some better quality, good quality, affordable provision within the borough, and that's what we're aiming to achieve, or part of that journey to achieve, with the new special school that we're planning in partnership with Reading Borough Council and the DFE in Winnersh for children with ASD and SEMH. We may want further provision on top of that to get even more children outside, back into the borough, out of expensive out of borough provision and not requiring expensive transport to school. But we've got a little bit more needs analysis because the range of needs that children have is so diverse that you've got to make sure that you've got an institution that can get a reasonable number of them. Behind this, I would say the information that I want to focus on is just the population projections which come to us from the Office of National Statistics. These are the only population projections that we really have access to. I think it is possible to write your own, but it's quite a labour-intensive exercise. So, like most local authorities, these are what we look towards, and they're projecting relatively low birth numbers throughout the period. I would say that that's not necessarily our experience at the moment, in that we've seen that for 2017 to 18 to 19, we've seen a rise in birth numbers, but we haven't. We don't know if that's a single year blip, or whether we've seen, or whether actually there is a sustained increase above the ONS's current projections. We do know that house building in the borough, much of it is actually justified by the ONS population projection, which seems rather strange when you see that the ONS population projection is projecting a fairly static younger person's population. But I suppose if we didn't build those house building, then we would see on the basis of their projection, you would see a significant fall in the number of children in the borough, as there wouldn't be the room for young households to form in the borough. What we are seeing, though, is the rate of house building is considerably above the current rate of the houses required to meet the housing need that ultimately comes from the population projection. And with that, we can reasonably expect that we will see additional children. So we're certainly seeing peaks of children, and the best way I can interpret the roll projections at the moment is that we are seeing rising numbers of children coming through slightly over and above the numbers of children that we get from the population projection. In time, the population projection will reflect the actual what's happening in Wokingham on the ground. So, of course, it potentially becomes self-reinforcing, and the future population numbers will underpin a case for an increased number of houses in the borough. Many of you will know that the government is currently consulting on a proposal for a new formula for calculating housing need in the borough, and that could generate a much more significant number of homes. That presents a fairly obvious problem for us in terms of projecting what the need will be, because if these additional homes on top of the calculated need are generating extra children, it's not difficult to see if you put an awful lot more family homes, and Wokingham is a place where house builders tend to build family homes, we will see additional children on top of those in the ONS projections. But they will be very much focused in the areas where the new homes go. Now, that is somewhat contentious, as you may know, and the borough has objected to those proposals, as have other local authorities and other bodies. So the consultation is ongoing, but until that's resolved and we know the number of homes that we're likely to be required to build in the borough, it's very difficult to ascertain what the implications of that will be for the numbers of children who need school places in the medium to long term. Okay. Gosh, I'm rather conscious of time. And perhaps if I can throw it open to questions, with your permission, Chair.
Yes, thank you very much, Piers. Pauline, would you like to go and ask a question?
Thank you. With regard to the post-16 and the need for more places, particularly as more housing is going up round the area south of Wokingham, north of Wokingham without, and around the Arborfield area, if we were to expand existing sixth forms, would that include sixth forms in Wokingham town? Because youngsters who live south of Wokingham certainly won't want to be travelling all the way up, say, to Maiden Early.
I think that undoubtedly, if we were expanding sixth forms, I would say that some of the Wokingham town schools would be an obvious place. I would say St Crispin School, for example, has planning consent. It has a new sixth form block, but it has part of the planning consent is for an extension on that block if we were to agree to an extension of that school. So I'm basically it's sort of future-proof and ready for it to take a potential new additional capacity into its sixth form. But the first question, I think, has got to be to sit down with the schools and work out what they think their current capacity actually is, their ability to take sixth form within their existing accommodation. Because so many of them are in academies for a number of years, they've done various building works and they have their own ways of running their schools as well. That we have to engage with them to understand what they think they can contribute without investment. If we're investing, there is an obvious case to invest for in the southwest on carbon footprint grounds, on traffic congestion grounds, and likely successful sixth form size, because the two schools together, and particularly the Bow Hunt is quite a large school. If you combine that with the number of sixth formers that come out of Oakbank School as well, you do have the potential to create quite a large viable sixth form in that area. But we do have to look at it in the context of, as I say, what will be best for those students. Many of them at the moment, of course, are voting with their feet, and they're choosing to go to colleges outside of the borough.
A lot will anyway. But assuming that the children who live sort of in the eastern side, just south of the railway line, might well go to St Crispin's if that's expanded, would there be enough sixth formers left in Arborfield to justify putting a sixth form college or sixth form block onto Bow Hunt?
Well, I think that's part of the discussion that we've got to have, is what's the best form of sixth form provision to produce the quality of education our young people require. Our sixth forms vary very greatly in size, and that's got to be an honest conversation with school leaders about what's working for them. There is a suggestion that sixth form should be no more. The minimum size for a sixth form should be about 200. Well, I'd say if Bow Hunt had a sixth form, it's likely to be around 300. So it's likely to be one of the larger sixth forms, and because of the, I suppose, relative isolation of the community, you're not sitting on the train line whisking you away to colleges there. It's likely to be ultimately quite a successful sixth form, if that was the best way to invest. And that's the discussion that we've got to have. Because, as I say, there are other alternatives.
Okay, thank you.
Andy.
Thank you. The thing which jumped out at me was the forest situation, where if you've got 110 vacancies, that must have a terrible impact on the school's budget. And I was wondering if we're anticipating it will be that many vacancies every year, or is it just like a one-off? And if it is going to be every year, what will that mean for I'm guessing the viability of the school? If you're running that many vacancies, because I think the normal intake would be about 200, wouldn't it? If you've got 7 forms of about 30.
I think we're going into a critical period, undoubtedly, in the sense that the roll numbers are rising. The number of children that are coming through from the primary sector is rising. So we would reasonably expect the numbers entering into the forest school to rise along with that rise in demand. It may not be for a permanent rise in demand, but we would reasonably expect forest's demand to rise. Will it? I think that's the $100 million question, which I can't answer. I mean, this is very much about, this is an area where parents do have some choice, in the sense that if they are concerned about a school, ultimately you will be able to get your child to another school somewhere else that will meet their needs. We have a population who have the ability to place their children, necessarily miles out of the area. So what we'll find is whether actually Forest are able to recruit from that potential. But the market is there for them. But you're absolutely right. It is a significant concern. But I can't answer for the future. The numbers are coming through. The numbers are rising. I would hope that they will be able to seize that opportunity, and parents will actively choose the Forest. But we have to see what they actually do on the ground.
So it's not a shortage of year sixes, year sevens. It's that the year sixes and sevens are just diverting around the Forest.
I think that's seems to be part of the issue. I think the numbers, if Forest was a more popular school, bearing in mind that we do have cross-border movement as well. We serve because of the way that the borough operates. Forest is accessible from significant parts of Reading, readily accessible. If its popularity turns around, its reputation turns around, whatever it is that's putting parents off. And I have to say, they do have this. Boys' education sometimes can be a difficult sell, but there are very successful examples of boys' schools. Then we'll see. There's no reason why we shouldn't see it rise again. But the numbers are only just starting to come through to the level where they match the current capacity of schools. Bow Hunt opened at 240 when it opened at 180 and then went to 240. We hadn't expected the school to be running at that level. Other schools have increased their capacity as well by a relatively small amount, adding a class here and there. I think but nonetheless, you've got this position where, we've got no girls' places, or effectively no girls' places. I mean, that's the bit that worries me much more, I must admit, as a place planner. I would expect that the number of places at Forest to start falling in line with rising demand. I think the critical time is from now onwards. If parents are actively avoiding the Forest and will choose to make other arrangements, then I expect that they would do. That they would be successful, even though there is demand pressure. I hope that won't be the case.
So I guess as a place planner, it would be much easier for you if the Forest were boys and girls.
Well, it's backed with Holt. So Holt, as a single-sex girls' school, single-sex girls' education does seem to be a much easier sell to parents. And Holt has had a long-standing, good reputation. It has to be said it has a much better Ofsted rating than Forest does currently. These are things that parents look at. But if you were to change Forest into a co-educational school, which yes, potentially so, then you do then have an imbalance in the borough in terms of only having one single-sex school. But yes, that might be a way forward.
Piers?
Mm-hmm.
Piers, I understand that the Holt now takes boys into the sixth form.
Yes.
So is it likely that the Forest may take girls into their sixth form?
I'm not sure that they're not co-educational. I think they just don't have a very big sixth form. But I thought that they'd both gone co-educational. I may be wrong on that.
Well, you're the place planner, so.
Well, I'm more concerned about getting anybody into it. It would be.
Okay.
Yeah.
So, I can. Sorry, Andy, do you have another question?
Oh, sorry, I didn't have a question. I've just taken my hand.
Andrew.
Yes, thanks. Yeah, we've been talking a lot about the real concerns about the surplus of places at forest schools, I'd like to talk about surplus places in some of our early schools. And I note that early has 57 unallocated reception class places this year, yet there are children in the years above who are having to travel long distances, including to Bearwood Primary and to schools in Woodley, because there are not enough places in the year above. What would be the logistics of converting some of the classes that are significantly undersubscribed in some of our early schools that could take pupils in, but who are not able to get places locally, enabling those children then to be taught with friends who live nearby and to cut down on long car journeys to and from their current schools? The second question is on a completely different issue, and I'm not sure whether it's appropriate to ask this or not, but the report is focusing, understandably, very much on pupil numbers and places. Are there any concerns about the recruitment of the right type of teachers in the right places? Now, right type could be subject matters, and ensuring a sufficient diversity within the the staff workforce and so forth. The right places, geographically. And are there any schools that have had to use supply teachers as a long-term strategy because of staff shortages?
I can't actually help you with the second part of your question about the staffing of schools. I know Gillian is here. I don't know whether you're able to comment on that, Gillian. Still see you. No? Okay. So it's not something, I'm afraid, that I have any information or understanding of, I'm afraid.
Sorry, Piers, I couldn't come off mute quickly enough there. Yes, recruitment is a challenge for schools in the borough, not least because we border some boroughs where staff would be eligible for a London waiting allowance.
Yeah.
Staff recruitment is an issue. It's something that we've been working on over a number of years. So we've worked on various strategies using social media to try and assist schools in their recruitment practices. In terms of particular subject areas at secondary, there was always pressure on the sciences and maths to be able to attract specialists there, notwithstanding the government bursaries that are available for those particular subject areas. We have, in theory, less issue at primary, but actually we're struggling to sustain our younger teachers being able to afford to remain with us in terms of housing prices. So there are some pressures in terms of staffing in schools, and we do from time to time have schools where they open in September with supply staff covering full-time classes.
Thank you, Gillian.
Okay. Now, if I can just turn to your first question that you raised, yes, I think there are some significant logistical challenges to dealing with the problem in the way that you suggest. First, it is possible. I have to say, I wouldn't rule it out entirely. It would have to be done with the agreement of schools, and of course the consequence would be that they've got a bulge class, and that can be relatively difficult to manage, particularly if you're trying to ensure the quality of education that you would reasonably expect. We do know that when you open a new class, it can take quite a while for that class to fill up. A new mid-phase class, say in Key Stage 3 or 4, years 3 and 4, it could take a few years before it's reached a level where it's actually self-sustaining. Basically, we have a situation where the numbers of children are, there's a constant churn. So we have children coming and we've got children going, and we've got slightly more coming than are going, as it were. So we have periods of time when we have great difficulty placing, and other times when we have some very limited headroom. But it does mean to say that when you're in that position, that children get placed all over the borough, wherever there happens to be the capacity. The difficulty, though, is still would be that if you open a new class, you've got to you've got to be reasonably confident that you will get enough to fill it in a reasonable period of time. And you've got to think about what the longer term consequences of that class is. If we can do it by opening classes, if you like, early in schools that have been expanded but are growing in size, but haven't yet opened the older year groups, then it just becomes an earlier expansion of the school. And that works reasonably well. Just in terms of the amount of money that we can afford to, in terms of supporting extra classes, because plainly, if you've got a class that's sitting there with a teacher in front of it, that's money coming out of what's called the growth fund, and it's money that would otherwise go into existing schools. So we don't have an infinitely large pot to deal with that. But I would certainly think in that area that we've got the ability to create at least another new class in, well, at least, we've got a couple of schools that we expanded, so at least one of them I would hope that we would be able to create a new Key Stage 2 class at some point. But one of the problems you would have or risks that you run is if you could get a class to agree, if they suddenly started recruiting again or filling up their year groups, if the numbers have been quite volatile, they're down now, but they were quite high in early, despite there not being an awful lot of house building going on in early. That wave of house building had largely subsided. I think Sibley Hall was the last big scheme, and it wasn't that big in the borough's context. There doesn't seem to be any obvious reason why we couldn't see ourselves returning to the kind of situation that we did early as a pressurised area. So if you put an extras class in, then you've got to have in your back of your mind as the thought is, well, what happens if the rest of the school fills up? In which case, then you would need to start thinking about, well, because the admission numbers are effectively set, you can't turn off the tap of children coming in. So you'd need to have a kind of reserve plan in the background to say, well, what happens if the school fills up and I've got a bulge class in permanent accommodation? So, yeah, I think it's possible. We are scheduled at some point, or the intention is that we will have a conversation with early head teachers about the situation in early. The DFE expects us, rather than just to change admission numbers, to actually reduce capacity. And I think people have rather more on their plate at the moment to deal with without adding potential school reorganisation. I don't think anybody would thank me for bringing that forward at the moment.
Thank you very much, Piers. I really appreciate that. And it's such a complex area. So thank you.
Okay, Abdul.
Thank you, Chair. Piers, our special education need disabilities children with mental health, autism, and care plans. How many of them are out of borough at the moment? And secondly, I'm very pleased to hear that the new schools in Waynish is going to be built. How long is it going to take? And you mentioned about other boroughs going to be here. Reading Borough Council also going to, Reading children also going to become here. But we make sure that we have our children as our priority first. Thank you.
Right. I would say, if I can just deal with the second issue first of all, I'm just seeing quickly if I can find some statistics to give you something of an answer on your earlier question. The nature of the project that we're engaged with is it's absolutely a partnership with Reading Borough. So we have a nominal split of 75 each. On the two sets of school needs, but it will very much depend upon the actual number of children either one of us have got at any one point in time. It's likely that we think that's a pretty good approximation to what our needs is in terms of the expensive children that we're placing into independent and non-maintained special schools. Now then, I was just looking to see if I got some statistics about the numbers of children that we place out of borough. I'm just thinking I might have something I might want to share with you. It's not a set of figures. Okay. This isn't quite answering your question, but the autism and social and emotional and mental health children that we place in the independent special schools, non-maintained special schools, and specialist post-16 settings. We had 32 in. These figures are about 9 months old, I think. We had 30 basically with ASD and 24 with SEMH. So you can see that's about 55 children, I suppose, in those categories, placed in the very expensive schools. And all of this provision effectively is out of the borough. There's one non-maintained special school in the borough, but it's a very, very specialist setting. And so it has a very small number of our children. We have no independent special schools or specialist post-16, so I'm absolutely confident that they are all out of the borough. Nick gave you a big table earlier on, you may recall, showing the number of children in and out of the borough. I think the point about that was that a lot of those children in the borough, about 2/3 of the children in the borough most of those children will be in mainstream settings, and a lot of those that are out of the borough will be post-16 students. As Nick observed, because we haven't got any post-16 provision within the borough outside of school sixth forms. So they're at Reading College, Bracknell College and Berkshire College of Agriculture are two major destinations. So we've got about 2/3 of our students with the highest level of special education needs still in mainstream. We've got just under 20% in Addington, and then we've got about 8% of them, which is what I was describing as the 55 with autism and ASD in the independent special schools and non-maintained. I'm not sure if I've got figures that exactly answer your question about how many with us that specific conditions we've got outside. No, I'm not sure. No, sadly, that's not a question that I'm afraid I came up to answer, but we can provide you with a written response if that would be helpful.
Okay, and when do you hope to build that new school then?
Open for 2022.
22. Oh, that's very pleasing. Good to hear.
Yes. Yes, so it's on track.
Thank you, Alison.
Thank you, Piers. Malcolm.
Yes, thank you, Alison. My thing is a mixture really of a comment and a couple of questions. Obviously, we know how many students we have and what exams they're taking and the results of them, the outcomes of them. We publish them every year. Do you have access to similar statistics from technical colleges, from local colleges, how many students there are in our borough that study there and what the outcomes of their exams are at GCSEs and GCEs? Do you have that figure? Do you have access to it?
Personally, I don't have access to it. It's not something I look at, but I don't know, Gillian, if you're able to unmute, you may have a better insight into the educational data we hold.
Okay, well, I'm on duty, I'm speaking. The reason for asking is that I have experience, obviously, of teaching. I say obviously, not obviously at all, but I have experience of teaching in a technical college and various schools of different levels. And my experience has been that with sixth form, the children generally do better in a sixth form if they stay on at the same school rather than go to a college. It's an arguable point, but from myself and all the colleagues at the college, we felt that when they leave school and come to a college instead of staying at the sixth form, they suddenly believe, oh, we've come into the world of adults and it's very different, and they act differently. The discipline and the regulations and the behaviour is far more sort of relaxed and less conformist. They call all the teachers by their first names. They're standing outside smoking. I know those aren't issues related to the teaching of it, but the attitude and the behaviour is very different in a sixth form college, sixth form school to a college. And I'm wondering whether, especially since we don't have a college anyway within our borough, we have to send them out to Bracknell or Reading. I quite like the idea of us having sixth form facilities within our borough, especially if they're able to stay at the same school. So the question is, do we have any statistics to compare whether it's more successful at a sixth form or a college? And where would we position the sixth form if we try to get more of them? So there's a few questions rolled up in there.
I don't know if they have borough level sixth form, but in terms of data by origin, that's not something I'm afraid I can comment on. But they will have statistics, and particularly kind of attainment statistics and improvement statistics. So it should be possible to understand how students are doing at specific institutions. But it's something we have very little control over. Most of our schools are now academy schools and will fiercely defend their sixth form provision. And the colleges themselves are, completely independent of the local authorities, and they are not in our borough anyway. So to an extent, it's a kind of given that part of the environment that we have to work with. So, we might think, I know other boroughs have decided historically that they would have much more efficient or certainly productive provision if they focused their provision into sixth form. You'll notice that Hampshire schools are generally 11 to 16, and they have a very successful and popular college in Farnborough, largely as a consequence of that. But it's not something that we actually have the levers on. So that's one of the conundrums and challenges that we have, is that whilst we have responsibilities to ensure that all young people are including sixth formers, have a course to go to, an appropriate course, we have limited say and control over how those courses are provided.
Yes, of course, I don't know what the numbers would be either, how many would want to go to college as opposed to a sixth form if it was offered. And the other general comment is that people might go to a college instead of sixth form, or the other way around, depending on what subjects they choose. If they have a particular mix, quite often, if their strongest preference is for a subject that's only given at the college, they'll take whatever their A-levels are, all at the same place, of course. So it depends what their subjects are and what the range is, both at the sixth form and the college, as to which they choose. It's just I have a personal preference and an interest in sixth forms. That's all. Yeah. And I don't know what the numbers are that would justify it either financially, but it's a topic of interest to me, and I was interested in your views. Thank you.
I would just observe that the sixth form colleges, in terms of as a sort of financial proposition, I take your point, there may be an educational point to it as well. The sixth form colleges will have a broader range of subjects than a school sixth form will be able to offer. And they will certainly be more financially viable in terms of the courses, because they're likely to have larger teaching groups.
Yes, exactly. Okay, thank you for that.
Okay.
Any other questions from members? Right. So, Piers, with the development of T-levels, it feels to me that, being able to offer more post-16 education within the borough, rather than our young people who don't want to travel out of the borough for their post-16 education. At the moment, it's mostly A-levels being offered here within the borough. And I also wondered if there was a link between the tiny number of our young people who take apprenticeships was linked to the fact that most apprenticeships involve going to college, for one day. And, we don't have a college here in the borough. Do you have any thoughts on that?
I think it would be quite a challenge for us to justify a college locally. Yes, we do have a large number of students leaving. Whether or not schools would be able to create sufficient numbers interested in those kinds of technical courses to to set up those courses and run them as viably. I don't know. I suspect it would be quite a challenge. You know, the tendency in the college sector has been certainly amalgamation of colleges. You know, what you've seen is much larger colleges rather being set up rather than you know, a multitude of colleges. So it seems to me the tendency is more away from you know, smaller localised provision at that post-16 level in the technical education. But yes, it's obviously a challenge for our students.
Because obviously we're all committed to our climate emergency action plan, where we're wanting to reduce travel. As a member said earlier, we certainly would like every family to be able to access their local primary school and walk to school, rather than, you know, adding to the traffic on the roads for the school runs. So equally, I think, you know, if we are not going to be expanding our offer of post-16 education, then I hope we're looking at improving public transport for our young people to get to Farnham, Henley, Bracknell, and to be able to engage in post-16 education that's not A-level on offer. Oh, Pauline's got a hand.
Just a quick observation as a former teacher. Youngsters are generally a great deal more successful in a school sixth form than they are at college, for the very reasons that Malcolm was explaining: the lack of discipline, the lack of construction of their day, and so on. So I'm really against sixth form colleges. And the other thing about them is that an 11 to 16 school doesn't have that upper academic level to which the under 16s can aim. And thirdly, if you're a good teacher, you don't want to teach in an 11 to 16 school, you want to teach A-level. And so you just don't get the best teachers necessarily at an 11 to 16 school.
I'm absolutely sure our schools with small sixth forms would echo that and would fiercely defend them, even if on paper they, you know, there must be a question over the viability. You know, simply for the value for the young people who do attend those courses and the value for the school as a whole. That ability to appoint teachers with an interest in A-level teaching.
Yeah, and the other thing is that schools with small sixth forms often do meld their timetables so that they go to each other's schools for certain, you know, small groups of, say, like music, for example, or German, when not many people are doing it.
Right, members, being very conscious of the time and that I would like this meeting to finish at 10:30. Can we move to recommendations? I collecting the feeling that we would like to make a recommendation about sixth forms or post-16 education.
I will second that, definitely.
Yeah.
Yes, I don't know what the wording would be exactly, but I'm in favour of encouraging and supporting our schools having sixth form capability within the school and within our borough, rather than them have to study at colleges outside the borough. I don't know how you want to make that wording up, but that is what I would be in support of.
Absolutely.
Thank you. Andrew?
Yeah, no, I was just going to make exactly the same point that Malcolm has just made. So I think one of the recommendations is, you know, to encourage sixth form provision wherever possible, you know, in our schools. But then picking up on one of your points, Alison, which again I totally agree with, is I think that you know, we should be aiming to try to broaden the range of options that are available within sixth form, within sixth forms, beyond A level. So, you know, BTEC, offering more BTEC courses and so forth.
Pauline?
Thanks. I've just got one problem with what Andrew just said. To encourage schools to have sixth forms, that might encourage all of them, and we might end up with too many sixth form places. So, can I actually make a proposal that this committee is committed to retaining sixth forms attached to schools within Wokingham Borough?
Yes, I agree with that.
I would support that.
So are we suggesting that this committee supports schools within our borough who wish to expand their sixth forms?
What about schools which are more appropriate or suitable for sixth form, rather than every one of them? Taking the point that we made a moment ago, we don't want all schools necessarily to have them.
I did make a
no, that's why I said to expand their sixth forms.
Words down. I did actually make a proposal which I worded. I don't know if Lucianne's got those words.
Sorry, Pauline. Yeah, Lucianne, could you read that back?
Yes, your proposal was to retain sixth forms attached to schools in the borough.
It's nice and simple, straightforward.
Okay. Sal, did you have a comment?
Yes, colleagues, just to remind colleagues that in terms of our secondary schools, all of them bar two of our secondary schools already have sixth form provision. So I think that the suggestion from Councillor Helly and Simmons around supporting and preserving those sixth forms that are existing with schools is helpful. I think that there is something also from Councillor Mikaraba's point around thinking beyond the traditional curricula that's delivered through sixth forms, and also starting to think about other post-16 learning within the borough as well, because we do lose a lot of learners out of the borough that do not deliver the traditional academic curriculum because there is nowhere else within the borough to deliver it, if that makes sense.
Yeah,
it does. Piers, could you stop sharing your screen now?
Yeah,
please.
And the other point I'd be interested in is the point I was making about subjects. One of the reasons they choose a college instead of the school may be the grouping of subjects. So that's an aspect that perhaps we ought to look at.
Could be a separate recommendation. Pauline, do you have a seconder for your proposal?
I'll second it.
Thank you, Andrew.
Okay, so can we move to a vote on Pauline's proposal? If everybody's happy, they understood the wording. Right, okay, I can see everybody's hand going up. Okay, if you could put your hands down. That looks like everybody's voted in favour. Thank you very much, members. Malcolm, did you have a proposal about the range? Oh, yes.
Can I propose we extend the meeting?
Yes, thank you. Members, do you want to vote on Andy's proposal to extend the meeting?
I'll second that.
Thank you, Andrew. Okay, so we are going to extend the meeting, so let's crack on. Malcolm, you wanted to make a proposal, I believe, about widening the offer to our young people for post-16 education. How would you want to phrase that?
We ought to look at the choice of subjects that the schools offer as an alternative to the college, which is what often attracts them away. I don't know what the wording needs to be, but it should be offering a range of subjects which are the most appropriate and relevant to the school that avoid students having to consider college in the first place. Along those lines, I haven't got the exact wording, unless maybe Pauline would be able to put something on that.
Well, I'm not altogether sure I could support that, because in one sense the schools determine their own curriculum, and they do that basically on financial grounds, what they can afford to offer. There is some flexibility in that. If there are students who want to do a particular subject, they will try and put it on, but it does have a cost.
Okay, that's the point. I don't feel that strongly about that second point. It's the sixth form I'm really strong about. I'm less strong about insisting that they offer a much wider range of subjects. So I'm happy. Okay.
Well, we certainly can't insist, Malcolm. I believe only one of our borough sixth form is not an academy. Okay, so do any member have any other proposal, or shall we simply make that one recommendation? No hands going up. Great. Thank you very much for that. The next thing we're going to be looking at is the forward plan before we move on to the part 2. Right. Lucian, could you please share your screen and pop the forward plan up? Thank you.
Okay, just 1 second.
Okay. Now, when I looked at the forward plan, it looked like it had the same thing on twice about looking at the SEND strategy, or is there a detail to that I'm missing?
I'm not sure that I am sharing my screen.
Yeah. So the I think.
Yeah, Alison. I sorry, Chair. I think that is a duplication.
Okay, well, that's good. That's one less item on quite a full agenda. Gillian, I'm presuming that the school performance indicators and Ofsted reports, we're not going to have anything to look at in January for that, are we?
No, we're not.
Okay, so this is going quite well, knocking things off. Right, we will be looking at the children's services, performance indicators, the SEND strategy, a report on child exploitation. That's all in hand. Is that your area, Sal, or Adam's?
That will be myself, Chair.
Great, thank you. An update on Compass. Those two are both items suggested by members, and then also the report about children who've had to return to the child protection plan. That's another one for you. Hopefully Ola Karim will attend with an update. So things from this meeting that have been highlighted, I'd made a note about public health coming back to us with a report about the cohort of children most at risk, struggling with mental health and emotional well-being. Adam, do you think that public health would be able to report in January?
Public health don't sit in my portfolio, but I would imagine there's plenty of time.
Well, I wasn't sure if it was. Yeah, I know it's outside us, but it feeds into.
I believe it sits under adult social
what we're
care.
doing. Well, I think we're. Okay, well, we'll discuss that, and if we can look at it, we'll bring it back. Although I think, was it Councillor? It was Rachel who raised that, wasn't it? And she was here because of her membership of HOSC. So yes, we'll send that over to HOSC.
Alison, I can speak with my colleague Madeline, who clerks HOSC about the possibility of inviting somebody from public health.
Okay, is Ken still on with us?
He's not in, but I'm happy to take this on board.
Okay.
As Lucina said,
I'm happy with that.
Okay. Yeah. Great. Thank you, Ken. Right, Andrew. I'm sorry, I made a note of your name under the forward plan, but not what it was you wanted to raise.
No, I was just going to say that, if it is at all possible to get someone from public health to come and talk with us a little bit about specifically about children and mental health issues, and particularly, if there are especially vulnerable, groups of children and so forth. I think it'd be really useful for us to, to be able to listen and to discuss that.
Okay, well, I think Ken was taking that on board, about whether HOSC might look at that and we would be invited to join their meeting, in the same way that they joined us tonight when we were looking at, children's mental health. Would that be okay, Andrew?
Yep, that's okay.
I mean,
one way or the other.
That
we'll
accommodate whenever public health can come along.
Yeah.
But I think there was something different, because what you're asking just then was what Rachel had raised. It was something from the minutes, I think, that you'd asked about.
No.
No?
No.
Was it something about the needs?
It was something.
If I can remember rightly, there was an item that Councillor Mickleborough referred to in the previous minutes related to the data report that I suggested that we'd be providing a written response outside of this meeting.
Okay, so is there anything else that members wanted to try and add to our meeting in January? No? Okay. I met with Carol Commis last month, and we discussed adding an extraordinary extra children's services meeting in February, which would be more of an educative session, when Carol could run through, and other members have heard, about children's social care, because I think there's often a lot of detail that we can't necessarily dig into, and Carol offered to give us this extra session, which can explain a lot of the things that I know we often have a deep interest in, and also perhaps give some anonymised case studies. Is that right, Adam?
Yes, I believe so, yes.
And another thing that we had talked about discussing in the forward programme was looking at children educated at home, and how much we know about that and what might be changing. I think many of you might have been copied into some correspondence last month about that. So Sal, we currently do have data, don't we, about the number of children educated at home?
Yes, we do. We can bring a briefing note to a future committee if it's helpful. We can also give committee a rundown in respect of the national and local arrangements as it relates to children electively home educated.
Great. Can we add that to March agenda then, please, Sal? And then another matter that has been raised at OS management was how we are able to be aware and helping children in poverty who do not receive free school meals, whether their performance at school is being impacted by that, and what we can do to help that. Gillian, I'm not sure what data you would have about children whose families are in financial difficulties, but they're not currently on free school meals.
We only have data for children.
Yeah,
we only have data for children eligible for free school meals.
Andrew, I think you were part of the debate at ONS management when we discussed this.
Yes, I was. But in the absence of sort of relevant, accessible data and so forth, it's rather tricky, isn't it?
It is. I mean, and Gillian, of course, at Key Stage 1, when all children receive a free school, I assume that the number of children receiving pupil premium at Key Stage 1 is not what it would be if families were applying for free school meals. Gillian?
Yeah, we still have our eligible vulnerable children at Key Stage 1, and we would have some data in respect of that.
Right. I think we need to discuss this a bit further.
Yeah.
As to how we can take any level of investigation into the families in poverty who haven't applied for free school meals. Okay. It might be something we can bring forward in March.
I'm just wondering whether another way of approaching this might be to try and involve some of the organisations that are working in the voluntary sector on this. People who might be able to provide sort of first-hand experience, case studies, and recommendations, for us to consider. In the absence of
in the absence of data, I'm not sure we can use anecdotal evidence.
No, but actual case studies and so forth from organisations like First Days, for instance.
But they wouldn't have. But we were talking. I think what was raised at OS Management was about children's their achievement in school being linked to their difficult home background.
Yeah.
And obviously First Days don't have that.
No. It needs more thought.
Yes, I think at OS Management I did say that I thought data was going to be a stumbling block here.
Yeah. If it's helpful, Chair, I'm happy that we go away outside of the meeting, explore what data that we have available to us that might be useful in exploring some of the questions that you're asking at the moment. And from that, maybe have a conversation about how we might agenda an item accordingly.
Yeah, I think we can, or perhaps take that back to ONS Management, Pauline, so that it can be we can be given a better steer on what they would like Children's Services to be looking at.
Yeah, we can have a look at that at one meeting, sure.
Thank you very much. Right, I've got to read out the statement now before we can move to the part 2. Bear with me because I've got to whiz up my iPad to the agenda.
I'm just going to ask my colleague David Clifton to be ready to stop the streaming.
Okay, that's great. And do you want to stop sharing your screen now as well?
Okay.
Okay, under section 100A, bracket 4 of the Local Government Act 1972, the public be excluded from the meeting items of business on the grounds that they involve the likely disclosure of exempt information as defined in paragraph 3 of part 1 of schedule 12A of the Act as appropriate. Can we now stop the recording and say goodbye to everyone watching at home? Thank you very much. Right, moving to item 37,